Welcome everyone to this meeting of the Oregon Early Learning Council, September 25th, 2024. We appreciate you being here and have a very exciting agenda ahead of us. So we'll ask our administrator, Gabby, if she would please call the roll.
Yes, Katie Brooks.
I'm here.
Peter Buckley.
Here.
Barry Ford.
Here.
Elizabeth Farrar Campbell.
I'm here.
Robin Hill Dunbar.
Here.
Dr. Peg Miller.
Here.
Subin O.
Here.
Ruby Ramirez is going to be joining late at around 11 a.m. So she's excused for now. Anne Marie Simons.
Here.
Great. And then I do see that Director Chatterjee is here, and the other agency directors will be joining at about 11 a.m. So they're excused until then.
All right. Thanks, Gabby, and welcome, Melissa. Good to have you with us as well. So, council members, as you know from the agenda, we're going to start out with an update on our very exciting initiative that we launched 2 years ago, with Peter and Peg providing the leadership for our home visiting system committee of the council. And we were wise enough to contract with Beth Green at PSU to set up this amazing coordination center that she's heading up. So I will turn it over to Beth with a huge thank you for saying yes to this little daunting task.
Thank you, Sue, and greetings, council. It's a pleasure to be here today and share a few updates. I only have 10 minutes and we have so much going on, but Gabby, with your permission, I'm going to share my screen and go through a few updates on the Cove Center. Let's see if I can get this going here. All right. Can everyone see my screen? Great. All right, so I'm going to go through a few slides. And again, thank you for having me. The hat I'm wearing today is as the director of the Center for Coordinating Oregon Home Visiting System, or the COVES, as we're liking to be called. Just a little bit of background. I know a lot of you know this already, but just to set the stage, as Sue said, about 2 years ago, there was really a shift led by the Early Learning Council to prioritize work that looked intentionally at these important and critical prenatal to age 3 home visiting services, and recognizing that the Early Learning Council and DELC and hub partners in the regions had done amazing work focused primarily on older children and those 3 to 5-year-olds, kindergarten transitions, kindergarten readiness, and that there hadn't been this intentional focus on 0 to 3, prenatal to 3, and especially on home visiting, which we know is a critical part of that service sector to address the needs of those families. So in their wisdom, they set up a home visiting committee, home visiting system committee. Peter and Peg are the chairs of that committee, and we continue to work with them. The committee established a work group, and that work group, after a year, came up with recommendations for systems change. So there were 17 recommendations, which I always like to laugh at that because I'm like, oh, there's a lot of systems work to be done here. 17 different things to address. And part of that was recognizing we need some capacity. We need, in order to really build effective collective impact, you have to have collaboration, and collaboration takes time. Also recognizing that because home visiting literally sits in all of the major state agencies that are part of the Early Learning Council, I believe, or at least in ODE, DELC, OHA, and ODHS, that there was a need for a program neutral and agency neutral backbone to really help lead the change. They approached us, and under, I think, Sue and Robin and Peter and Peg's leadership, there were cross-sector investments in the coordination center in 2024. So I like to think of us now as just about 9 months old. So we're still in our sort of perinatal period, but we've been doing a lot of work. So I'm happy to share that with you. Our North Star, and this is part of what was given to us by the committee in their wisdom, is to support state partnerships that support local decision-making and implementation, right? So state guidance and support for regional implementation of these equitable, what we hope is an equitable, accessible, and inclusive family-centered system that really looks at systemic barriers and structural barriers that we know exist because of racism and other biases in the system. So that's our North Star, right? We know that state leadership is important, but the real work is happening in our regions, and those regions all look different, and those communities all look different. Our role is a program neutral backbone, which I've already said. Oops. So I want to talk a little bit about the 4 priorities of work that we were given and how we've been working to move forward. So first priority that was established by the recommendations was to build collaborative culture and shared vision. This is really foundational for any kind of collaborative work. And we learned through some work that we had been sharing or doing with the Ford Family Foundation under Robin's leadership, that relationships are the key, right? This is almost a truism, but it's really true when you're trying to bring people together across sectors. So we've done a lot of work to build relationships, trying to share understanding, even knowing, first of all, what programs are out there. How do we get different agencies to learn about each other's programs? And how do we lift that information up so that everyone knows what's currently out there, what's existing in home visiting? So a lot of our work has been around communication. We've got a website going, which I'll encourage all of you to visit. We've got monthly newsletters and communications, encourage you to sign up for that on our website. And then we're working on a shared action plan with our advisory groups, which I'll talk about in a minute. I do want to show you, I give you a sneak peek at one of the things that we're working on that's going to be coming out this fall, which is our program overview and infographic. So this was something that was a priority question that when we talked to people about, what does the home visiting system need? They said, well, we need something that tells us what programs are out there, what ages they serve, and where they're available, right? So we had some work to build on, mostly with our major state agency funded programs. So there's a couple things I want to point out to you. This is the first page. It's a screenshot of the document. It's a draft, as you can see. But one of our mandates is to really focus on equity and inclusion of our culturally specific and tribal home visiting partners that really had not been having a voice at the table in a lot of the state level home visiting work. So we have in our home visiting overview, we have both our major state models. We have our Early Head Starts, our Cocoons, our Family Connects Oregon, but we also are intentionally trying to include culturally specific programs, the Black Parent Initiative, programs of our tribal nations, programs of our Latino and Hispanic serving communities, Adelante. So we are really, really doing an intentional job of reaching out to those communities. So this is the first page of this document. Let me show you the second page, which then this gets into the program overview. We have program information that includes where those programs are offered and what their eligibility criteria are. You can see they're not all across the state. And then we have a county by county breakdown, so you can look at each county with live links to those programs for more information. So this is going to be coming out in the fall. We're really excited about it and hope it's useful. Couple of other priority areas, and I know I don't have too much time, but a few more minutes. Our second priority, so lots of information that we'll be sharing with you in the coming months. Our second priority area was really to expand and strengthen governance. Recognizing that there was a need, there had not been a table really at the state level or regional levels that intentionally focused on those prenatal to age 3 home visiting services. So we wanted, and in doing that, we wanted to really, again, lead with equity. We wanted to make sure we were creating family leadership, which had not been at the table in terms of our early childhood home visiting systems. And we wanted to engage, again, our culturally specific and tribal communities in those leadership and advisory groups. So we're really excited to be moving forward with some guidance and recommendations for state level implementation of family leadership of home visiting. We've got a new up and coming, very excited about this, family leadership group that's actually going to be working with ODHS to help provide the experiences and perspectives of families with lived experience with those prenatal to age 3 home visiting services for their Families First Preservation Services Act redesign. So that's a really intentional engagement of families in that high level system process. We've also got representation from tribal home visiting programs, tribal leaders, and culturally specific leaders across all levels of our advisory group. Oops, I'm going away. There we go. Our third priority area is to align and ensure adequate financing. And so this involves several different pieces of work that are happening right now. Part of that is communications and advocacy. One of the challenges for home visiting and really making sure that families are getting the equitable access that we believe all families deserve in terms of home visiting is breaking down barriers around knowledge and making sure that everyone, including our medical communities, doctors, hospitals, everyone who's contacting those pregnant people and infants and toddlers is normalizing home visiting and setting the stage that families, it's not a question of whether they get home visiting, but it's an expectation that every family needs a home visit. So we're working on advocacy and communication. We're also working with advocacy leaders, the Early Childhood Advocacy Coalition. We're working on some strategic partnerships around legislation with the Momnibus Bill and other things. We're also trying to really figure out financing and how to build more sustainable and equitable funding for both the home visiting system infrastructure as well as programs. And we learned a lot from some other states who've really done an excellent job in creating a shared table for making decisions about home visiting funding that's really maximizing available funding streams that Oregon may not be tapping into right now as effectively. So we're leading that work. We're going to be contracting for a comprehensive fiscal analysis of Oregon's home visiting financing systems, and that'll be rolling out soon. We're also, as I said, really focusing on equitable funding expansion because we know that our culturally specific programs are marginalized from accessing a lot of the federal and other kinds of major funding streams for home visiting. So how can we shift that? How can we create better pathways for those programs to get funding? All right, the fourth priority area, and I can wrap it up quickly, is our collecting, improving, and using data. Now, those of you who have known me for a while know that I've spent literally my whole career trying to make data useful to agency and program partners. So that's a key part of the COVES. We're compiling just a ton of information. We have been doing interviews with all of our hubs, all of our county public health leaders, all of our Family Connects alignment specialists, ODHS partners, to create what we're hoping will be a useful set of what we're calling opportunity maps and a statewide landscape to really find out where across the state there's good work already happening that's trying to coordinate home visiting services and create those easy to access, one point of entry contact places for families to enter and receive home visiting. So we have that going on. We also are doing a statewide systems evaluation that will be ongoing, and we're developing some metrics to understand, like, we really want to be able to measure and know that we're making a difference, that we're creating systems change that is in alignment with the Early Learning Council's priority and vision set out under Raise Up Oregon. So all of that is going on. A few things coming up, as I said, there'll be a lot of, hopefully you'll be hearing from us with some recommendations for your approval around state level guidance for regional implementation, regional coordination expansion work, hopefully investing in some of those regions to really grow coordinated home visiting regionally, supporting the workforce, doing our fiscal analysis, and of course, doing our shared measurement. And then I want to leave you, because I know I'm out of time, with a list of the many things and resources that we'll be putting out over the next few months as we leave our perinatal period and start working towards our first and second birthdays. So with that, I will stop my presentation. I don't know if there's time for quick questions or if you need to move back, but thank you for having me and looking forward to coming back and sharing more.
Yes. Thank you, Beth. And Representative Reynolds, welcome.
Yeah, I mean. Sorry, I'm not hearing people.
Oh, can you hear us now?
Oh, wait. Okay. Yes, I can hear you now.
Okay, wonderful. So welcome. And I want to thank Beth Green. She just gave us a quick 10-minute presentation on the work at the Home Visiting System Coordination Center at PSU. And you, Rep. Reynolds, are going to be really excited by an infographic that they're putting out in shortly that shows where the home visiting programs are all over the state. So it's
awesome.
You asked me for that probably 4 to 6 months ago. And I said, I don't think one exists. So
yeah,
it almost exists. So we're delighted we'll be able to share that pretty soon. But welcome. We're so happy to have you here. We know it's Sledge Day is so super busy for you. And on behalf of the council, I really want to thank you sincerely for your leadership in putting early childhood, young children and pregnant people on the public map. So people actually are thinking about and talking about these people who are frequently sort of invisible. As people say, 0 to 3-year-olds don't vote. So we appreciate you giving them a major vote and voice.
Great. Well, I'm really happy to be here. And yes, thank you so much for taking up the work of trying to disentangle our very hard to maneuver, nurse home visiting system. And really excited to see how that's moving forward and that it is, knowing that it is moving forward. And so my name is Lisa Reynolds. I'm a state representative from Oregon House District 34, which is mostly unincorporated Washington County, just west of Portland. And also I'm a pediatrician in Washington County, just west of Portland. So it's been, I always talk about when I knocked doors a few years ago, people like, what are you doing on my doorstep? Dr. Reynolds, what are you doing on my doorstep? So that it's been fun having that mesh a little more as I hear from my patients, like, oh, we saw, we got your mailer and things like that. So, and that they understand that I'm, my work in the legislature is obviously informed by my clinical work, which is still happening pretty busily these days, although I will be scaling back once the long session starts. And, I will, I'm finishing up, my 4th year in the legislature, and I'll be honest, I think it's taken me a while to really find my maybe niche, for lack of a better word. Certainly healthcare, I'm pretty involved in a lot of the healthcare conversations, but it became pretty clear to me that our youngest Oregonians were often being left behind in policy discussions, in allocations, and so I really have been leaning into this, I'd say, for the last few years, and it's culminated in what I'm focusing on for 2025, which is what we affectionately call Momnibus, which is a robust maternal child health bill, which I want to talk about in a minute. I see that Governor Kitzhaber has joined us, and I know he's addressing y'all at 10. I have other meetings, so I'm going to have to leave for that. But he and I are, if not in lockstep on this, pretty close to it, and certainly talk often. I've already looked at his remarks for this morning, so I'm not going to repeat. He says it so well, but I know we're all speaking to the choir here, understanding, the vital importance of, upstream investments, policies that prevent childhood trauma and childhood poverty, or that cure childhood poverty. And that's really where I'm focused in my work, laser beam, going forward. A corollary to this is that I am the chairman of the House it's called the House Interim Committee right now on early childhood and human services. And I sometimes hear grumblings like, why are those together? And it's so clear to me why they're together, right? That if we did better in the early childhood space, I think our human services burden would decline in the sense of we can alleviate, prevent, make less some of the disabilities among our developmentally challenged kids. We certainly can prevent child welfare involvement if we do some, pretty easy but savvy upstream investments. And another thing that I keep hearing, especially as we're in a situation where I think we're hearing that the budget may be a little more constrained than what I've been used to. I mean, remember my first term was 21-22, where we were kind of awash in ARPA dollars, where each legislator individually had some money. I got $2 million to spend on a project. I focused on Street Roots because I'm so impressed with the work they do with our homeless population. So nothing like that will happen again, right? Hopefully, because that was also because it was a global pandemic. And so we're getting, we're in a tighter fiscal environment than we have been earlier in my legislative career. However, what I keep saying, and Governor Kitzhaber and I talked about this last evening, is like, I don't think any of us are presenting anything new, or, we talk about, these legislators and their new shiny thing, right? And just adding on to the programs that are already in existence. I don't think we're talking about anything new. We are talking about maybe reallocating or rethinking how we prioritize state resources. And that's really the conversation I've been having with my colleagues, with agency staff, with advocates, and with the governor's office. And none of this will be a surprise to any of you all. So I know I've talked to several of you already about the Momnibus concept, which we are, concept of a plan, no kidding, concept which we are, we're really spending this week because Friday is the legislative concept request deadline for pre-session filing. So there's an important deadline, but not a end-all be-all deadline on Friday of really, how are we really going to talk about implementing some of the things that I've been talking about a little bit more broadly with members of the community. And that is, we kind of talk about 4 squares, and we are in the process, and I'll just show you the visual. I know you're not able to read it. We're in the process of updating this, so I don't want to send it yet. We're literally going to be updating it today and tomorrow, and we'll send that around to y'all. But the 4 squares, we decided not to do pillars or legs of a chair, 4 square like the game, that's how it's supposed to be, sorry. Is housing, so right, housing, ending child poverty, access to behavioral health services, and expanding the perinatal workforce. So we come at this with with acknowledging that the United States still has the highest maternal mortality and morbidity rate among wealthy nations. Our infant mortality has been on the rise for the past 2 years for the first time in decades. And our outcomes among our kids, whether we measure kindergarten readiness, access to childcare. I see Director Chatterjee here. Mental health issues, including in that kindergarten readiness. I think I want to think about emotional regulation, let alone kind of academic readiness. And of course, child welfare involvement. I've come to understand that something maybe I didn't appreciate before I started looking into the child welfare system more carefully, but that, once someone becomes child welfare involved, and certainly once they're separated from their family of origin, usually for very good and very tragic reasons, their outcomes are definitely very diminished, and their cost to the state is very high. So, we need to do all we can to prevent a child from becoming endangered or a family to be in a situation where they need to be separated. And this is where I think all of child welfare is moving towards a much more robust preventative model. So, and then obviously if we can surround families, pregnant people and families with everything they need, helping meet their basic needs, we will see just amazing improvement in especially what we call early relational health, or what we used to call attachment. You know, Dave Willis talks about the first 2 months being so instrumental. And when you're dealing with the toxic stress of poverty, when you're dealing with substance use disorder, when you're dealing with not knowing where you're going to sleep tonight, right? It makes it very hard. It really disrupts that early relational health. So let's do everything we can to help parents be the parents they truly want to be. So housing, we're really looking at a bunch of levers to really, I think, provide stable and safe housing for someone from prenatal through the first year postpartum or the first year of life for that child. And we're looking at braiding. I actually don't really like that term, but we're looking at braiding several funding streams, whether federal HUD money, which Governor Kitzhaber knows more about than I do. We're looking at the 1115 housing waiver for Medicaid recipients, which is 6 months of rent support, and really hoping we can encourage that the prioritized population and the many people who are eligible for that should be pregnant people and parents of infants. We're looking at obviously a general fund ask. You know, if we're going to do housing supports in 2025, we need to earmark it for the population. And I think several of you have heard my story about in January of this year, an OHA commissioned report at the tune of $300,000 came out looking at our behavioral health system, a gap analysis on where we were and what we needed for inpatient beds. And we're short about 3,000 beds, about 2,000 of which are for substance use disorder, residential substance use disorder treatment. And there's not one word in that $300,000 study about the KIDS system, about kids. And when I brought this up to people, they're like, oh no, you have to specifically say, also study the kids. And I'm like, do we have to specifically study women aged 30 to 45, right? You know, so I'm realizing we have to specifically say time and time again, and I know that the bell, all of you in this room, this virtual room, will be ringing going forward. You know, it's kind of cheesy, but like, what about the children, right? But it's absolutely what we have to. I've just learned, you know, and Shannon Watts, one of my role models, who's the founder of Moms Demand Action. Like, if you're not at the table, you're on the menu, and I really think that's the case for our little kids. And also another thing I've kind of realized is the parents of little kids are too tired to come down to the Capitol and really advocate, right? So it's on us. So housing, right? And I do want to talk for a minute, and again, I know this is repetitive for some of you, that I am with Momnibus for 2025. You know, this is a step towards ending child poverty. You know, that's my ultimate goal. I'm looking, you know, right above my computer here, I have a little sticky that says end poverty, which is something I stuck up there in 2021. That was my realization, right? If we could end poverty, how much better the world would be. I've been focusing on child poverty because it's a little more politically palatable, I'll be honest, for people on both sides of the aisle. I care about poverty for everyone, but focusing on child poverty gives you a little more political cachet. And we know that by eliminating child poverty, obviously we're helping the family. But I'm focusing on prenatal to 1, because obviously it should be till 5. It should be, you know, all of these protections should be in place for much beyond that first year of life. But I'm leaning into kind of some of the Medicaid spending, and knowing that we have expanded coverage for pregnant people, Medicaid coverage through the whole year postpartum from what had been 2 months. I think I looked it up last week, actually. I think 47 out of 50, I'm sorry, 47 out of 50 states have done this. Wisconsin hasn't, which is whack. And the 2 other states who haven't yet done it are pretty close to implementing it. My take on it, from talking to a lot of providers of women's health services, is they haven't really changed what they're doing. Like, they aren't following up with the women at 6 months postpartum. They do their postpartum visit at 6 weeks. From what I hear from my patients, probably 50-50 chance they're actually even doing those, because they're still like in the fog of postpartum. But what I'm really looking at, how do we leverage, you know, now that we've expanded this coverage, now that there are resources attached to these humans, we need to be using those resources, because again, this is where there's still a high risk of maternal morbidity and mortality, and then of course the early relational health. So I'm focusing on through the first year of life, Obviously, it should be longer, but that's what the focus is for 2025. And it's how I've been able to somewhat circumscribe this a little bit. The second square is ending child poverty. I'll admit for a little while that second square was basic income. I'm taking a little more of a broader approach to how we end child poverty. Basic income, of course, being one of the pillars for that. You know, anyone you talk about basic income with will say, we don't need pilots, we don't need proof of concept, we know it works. And however, we will probably be talking about some basic income pilots as part of Momnibus, only because we are probably not in a place financially to roll it out across the state. My basic income programs will probably be means tested. It won't be universal. And we are looking at the model of RX Kids in Flint, Michigan, which is actually universal basic income for kids 0 to 5 for all comers in Flint, Michigan. It's a mix of general fund and philanthropy. It's pretty amazing that we've been able to get this little silver lining out of all the disasters that have happened in Flint, Michigan, especially around poverty and lead poisoning. But it has led to an advocacy in that community that was able to get basic income for you know, it's tied to how many kids you have. So we are looking at that using, again, braiding, you know, maybe philanthropic dollars, some general fund, some relooking at TANF also. So that's, as you can see, we're still percolating on some of those and would love feedback on any of this stuff. In my practice, I take care of quite a few kids in foster care. And the number one reason why kids enter foster care is because parental substance use disorder. We certainly know poverty and neglect is part of that, and we need to do better on that front. And it's something we've certainly been talking about in the human services sphere. But if we could do better in providing substance use disorder treatment for people who are pregnant and people who have babies, we would go such a long way to repairing families who are really suffering, preventing child welfare involvement and the like. And I've seen some model programs most recently in Medford. I don't know who's here from Medford, but visiting Dr. Heacock's program, Oasis in Medford, is truly inspiring. It's a family practice clinic that focuses on parents with substance use, pregnant people and parents with substance use disorder. They have an on-site daycare, so the parents can have their appointments with their providers in the clinic, somewhat uninterrupted. They have adjacent housing for people who are ready to go into residential treatment, but there's not a slot available yet. So giving them a safe, warm place to stay while they're awaiting treatment, it's almost like treatment light. There's just so many innovative, cool things that they're doing in Medford, and we need to think about how we replicate this across the state. And so there's that, and then just overall mental health services, because we know the scourge of postpartum depression or even baseline depression, postpartum anxiety or baseline anxiety, how that is a huge contributor to maternal morbidity and mortality. So we need to increase our behavioral health workforce. We need to think about how we're reimbursing those services. And then, you know, the corollary to that also is expanding overall our perinatal workforce, especially as it comes to community health workers. So I'm a big fan of, you know, you guys know I'm a big fan of nurse home visiting, right? But I think we can leverage that into more touches with families as we expand a community health workforce, whether it's a postpartum doula or a pregnancy doula or a birth doula, to really have more touches with those families, to provide the support, to provide parenting classes in the home as well as in community. So we are looking at ways to increase spending and reimbursement for those services, and that's kind of where that this Medicaid bucket comes in for that. We have coverage for these people. We're not doing much with it. Here's some things we could and should be doing with it. So that, and we know, you know, we have all the evidence, and you all know the evidence on how these things work, how they save money in the long run. They're not only the right thing to do, they are economically the right thing to do. I talk a lot about Heckman's curve, that we know the earlier that we invest in the prenatal and first year of life, the higher that rate of return on investment. We continue to do the ambulance at the bottom of the cliff instead of the fence at the top of the cliff. And then I do want to thank Sue and her team. And again, for this crosswalk, and we can email this out too. I know Sue and Gabby have this as well, but this shows where Momnibus is aligned with Raise Up Oregon. Obviously there's, bazillions of places of overlap, if not, a total Venn diagram overlap. So I kind of wanted to end there with my remarks and hear people's thoughts, hear questions. I know the devil's in the details. And like I said, we are not looking at bright, shiny new things. We're looking at rethinking how we're doing things currently. I know that I've had some folks say, Rep Reynolds, it sounds like you're just doing the same thing, but slightly differently. And that might be true, but I don't want to be building. I was thinking about how many maps I've seen in the last 2 days of 13 dots on the map, whether it's public defense offices, or of course, early learning hubs or CCOs, or I don't want another map of 13 dots of some new delivery system we're putting in. I think we're really looking to leverage our early learning hubs, and I've really enjoyed getting to know more and more folks from the early learning hubs. Love the model out in Yamhill County, Yamhill Community Care, the CCO, which is, embedded, or whatever, one's embedded in the other, the early learning hub, and Governor Kinsella knows that better. And then furthermore, as we think about our CCO reprocurement, calling it CCO 3.0, I would say Governor Kinsella and I are really trying to figure out how we best insert ourselves in that conversation and really come up with more and more CCOs, some of which are doing this, like Peter knows well. Peter has great interventions and outcomes down in the Ashland area. But how do we do that better? How do we really hold CCOs accountable for upstream preventative spending? And, in pediatrics, we often talk about, what do we spend in the first 3 years of life versus the last 3 years of life? That disparity, I mean, I'd love to turn that on its head. Not that we need to take care of our people near the end of their life. But so I'll leave it there. Would love people's thoughts, comments, ideas. And you all know how to find me too on email, rep.lisareynolds@oregonlegislature.gov, which is a mouthful, but pretty easy to Google. But yes, Marie, I'm happy to, I'll have someone else manage unmuting. Sure. Yeah.
I'll be glad to do that, Rep Reynolds. And great. Thank you very, very much. I want you to know that we, the council, are going to visit the OASIS program later in October. Peter has set that up for us. So we're excited to see that as well. So Marie, and then Subin.
Thank you so much. And Rep Reynolds, really appreciate your time and the thoughtfulness and your advocacy in all of these issues that really matter. 2 quick questions is that we heard you speak this morning about this Momnibus program. The first is just around wondering if you could share with us a little bit about your maybe stakeholder in development, and do you have some rural voices at the table? I come from a rural area. I know there's a few of us here that really lean in on rural issues. So wondering if you could talk about, how you're seeing rural play into some of your priorities. And then the second question, and I wondered if you could share, I didn't hear you maybe address childcare specifically. And it's just such a huge issue, in particular in rural. There's pretty well established priorities and issues in order to sort of move the needle. And I wondered if you could address that in the Momnibus package as well.
Yeah, thank you, Marie. We have held quite a few stakeholder meetings with people across the state. And I'll be honest, it's been probably a little more healthcare focused, like meeting with doulas, meeting with folks like Black Futures Initiative, which is is really focused on improving outcomes for Black parents, Black pregnant people and parents of babies. And we're trying to be, we've held 2 huge roundtables. We have another one on October 9th, 10th. I'll send an invite. It's for all comers and it's virtual, of course. And I think what I'm hearing about from rural is, of course, the concerns around birthing centers and how rural Oregon has it's farther to drive to give birth, which is very problematic, and of course workforce around, especially around community health workers. So I will say that I'm probably not being specific enough for you, but we certainly do care about the whole state. One group that I've been working with a lot is the Oregon Perinatal Collaborative, and this is a group of providers of maternal care from all over the state, and hearing from them what their needs are, especially around workforce. Because this is going to be a big lift when it comes to workforce. But what I love the community health workforce model, because it's people from the community serving the community. It's people upskilling their current skills. People hopefully family wage work that's both meaningful and really vital. Childcare, I will just say Momnibus is not going to be a childcare bill. Of course, and you can ask Director Chatterjee and anyone who hears me talk about it, childcare is vital for parents, in that first year of life and beyond. But I'm focusing on those 4 pillars, and that's I just have to, draw the line somewhere. But of course you can't find a stronger advocate for expanding ERDC. I do think the child poverty aspect of it is, and I'm going to say something that might be a little bit controversial, but when I sometimes think about that, there are families where parents are working specifically to make ends meet, right? And then as opposed to me as a doctor, right, which I know is a totally different world, but as a doctor, it's an incredibly rewarding career that I worked very hard to get to, and I love it. And I remember being really sad to leave my 3-month-old baby, but being really happy when I walked into the clinic, right? I do wonder if there's some nexus here where it's not so much about making sure someone has access to childcare, but maybe making sure someone who prefers to stay home with their baby has the resources to do that. I mean, it's obviously a yes and I know this is kind of old-fashioned welfare queen talk, right? If you want to go back to the Reagan disparaging people who are, home with all their babies, so to speak. But I do want to look at that too. I think that's really interesting to me. But absolutely, we need, we have, and we are still, the governor will say, we have poured a lot of resources into childcare, both infrastructure and of course, our employment-related daycare subsidies. How are we doing? And I think we're still answering that question. And maybe Director Chatterjee has an answer for that, but I think we're still compiling how well have we done on improving the childcare infrastructure with quite a bit of expenditure over the since 2021.
Okay, thank you, Rep. Reynolds. We'll let Alyssa talk about that later.
Oh, right. I'm sure that's on your agenda.
Yeah.
Yeah.
Subin.
Comment and a question. Thank you, Representative Reynolds. My brain is already thinking about implementation and how do we, let's imagine a world where we get everything we ask for and let's start moving. And one of the things that I have experienced or seen and witnessed in the last few years with DELC is, no fault to them, when we're coming up with budgets for what needs to happen within DELC to administer, or not just DELC, but all the agencies and what needs to happen to administer these programs, one of the things that I don't think gets talked about enough is communications and how things get communicated out to the field, and not just informing people about the services, but also conceptualizing how it all connects. And in the same way that you came up with the Momnibus and you try to fit all these ideas together in a cohesive way, that's something that I think just needs to be properly resourced. And then my question, I'm noticing that we're talking about supporting implementation of suspension expulsion prevention program in the Momnibus, and I'm on that advisory committee. I'm wondering if there's something that needs to be relayed to the advisory committee about, when we're talking about maternal health, right, and well-being, and the intention behind here, what is something that you think you really needs to happen in that program?
Well, thank you. Thank you for that, Subin. And yes, you're absolutely right. And I will acknowledge, and I think most of my colleagues will acknowledge that even though it's hard to pass a bill, that's by far the easiest part of the process, right? Seeing it through implementation. And that's why we're also having frequent conversations with OHA on some of these concepts, with DHS on some of these, and I will be following this through. It's not going to be like, oh, signing day, I passed this bill, I'm done, right? As tempting as that is, right? So communications, I totally agree, is going to be really important. You know, here's the thing about the suspension and expulsion work, which I think is seeking to, you know, I think Director Chatterjee will say that, you know, we're really seeking to help provide our early learning providers with more tools, and, you know, how do we respond to kids in crisis? How do we respond to kids who are dysregulated? I'm really hoping that if Momnibus really works, we are going to see a much lower rate of kids who are dysregulated. We're going to see improved early relational health. We're going to see parents who are less stressed because we've removed the toxic stress of poverty. And that's really my dream. And I think that once the 3, 4, 5-year-old comes to school emotionally dysregulated, of course, we need to help them. We need trauma-informed interventions. We need deep family counseling, because obviously, you know, what we do in the public setting of the school is important, but it has to be followed up with what's happening at home. You know, what I'm really hoping is that, you know, we have really helped a family get on the path to raise their kid in an environment where they're less dysregulated. That's the dream. That's the goal. That's the gold standard here. So easier said than done for sure. But I think we put so much on families. It's not surprising that their kids show up at school just kind of hanging on to life by their fingernail.
Yeah. Thank you, Rep. Reynolds. Peg Miller.
Hey, Peg.
You're muted, Peg, or whoops, we can't hear you.
Is that better?
Yes.
Okay. I just really wanted to thank you for giving voice to the same things that I have seen and heard for years from families and the needs, and really want to beat the drum for the early relational health. I think that is a game changer. And if we can develop that and educate people about that, it doesn't cost any money once we can share all that knowledge, because it's common stuff. I share the concern about the rural health and just the sheer number of practitioners and areas that are closing for a whole variety of reasons. And the resources, I'm from Yamhill County, and the resources involved in getting maternal medical homes. I think we really need to focus on that, particularly in rural areas. And lastly, I am all in favor of traditional healthcare workers and doulas, but we need to train them appropriately. Right. I think, particularly within the medical community, sometimes people that aren't in medicine get discounted, and oftentimes it's because of their level of training. So if we can train them up, I think that's going to be a really valuable resource.
Yeah, and I'll be honest, Peg, I haven't looked carefully at what the current doula training is. I should. You know, maybe you and I should both, you know, to see, you know, because we're both pediatricians, right? So to see if that's something that we feel is kind of where it needs to be for what we're asking doulas to do. I think we also, you know, I hear very mixed experiences from doulas about how they're accepted by the you know, obstetric or even midwife community, and that's education there also. And then I had one thing I just want to say about the maternal medical home. I think, and Peg would love your thoughts on this too, but like, I think that You know, if you are, I think for the most part in Oregon, if you are connected with a person who delivers babies, you know, I think, you know, prenatal care is pretty cookbook. I mean, it's not to discount it, but like we kind of know how to do prenatal care pretty well. You know, when you are, when you've had a healthy pregnancy, you know, the birth usually goes really well. And then they see you for your postpartum visit, and then it's crickets, right? When it comes to the maternal medical home. And I don't think OBs are in a place where they're thinking about, wow, how do we capitalize on this year? Like, let's really make sure we're tuning up everyone's mental health, physical health, you know, let's make sure we're helping them meet their social determinants of health, right? And I think that is a big culture change. And as much as I would love for it to be happening, I'm not seeing that it's happening. So I think, like so many things, it's gonna rest on the pediatric office, right? We see these families all the time. There's a pretty robust checkup schedule in that first year of life. And I will tell you, when I have a parent that I'm worried about, because we screen them, we do their ACE scores for the parents, we do in the pediatric office, and I think most pediatric offices around the state are doing this now. We screen the parents for postpartum depression. You know, when I get on the phone with an OB's office and say, hey, I saw, you know, baby Susie's mother, and she's struggling with depression, and she hasn't gotten in for counseling, and, you know, she ran out of her Zoloft, whatever, because I'm having those conversations with the parent. You know, the OBs jump. I mean, they're great. They're like, oh my gosh, we will call her. Thank you. You know, but they're not going out there trying to find Susie's mother, right? So we have to think a little bit about how we're operationalizing this. And I think it's a little bit tag your it for pediatricians, because we're already kind of doing this. But I think we have to think about how we really change the culture of postpartum care for the adults. And I think that's going to be much harder to do. I'm not even sure it's something we can legislate, but they would say it has to do with how they bill and stuff. But it's more their mindset. And I'm not saying it in a bad way. They're deliverists, right? You know, they're like, oh, baby's delivered, you know. They're not even, you know, I find so many women at the 2-month visit, they don't have a contraception plan. I'm like, how can this be? How am I talking to you about your contraception plan when my patient is the 2-month-old? But that's what I do, right? Because I know the stakes are so high. So if any of you have an in for culture change among obstetrician practices, please let me know. Okay, thank you. Getting off my soapbox.
I would agree with that, but I also think with the shortage of OBs nationwide, that maybe we could offload that, not just to pediatricians, but home visitors.
Right. No, I think that's true. I don't want to dismiss how hard it's not that they're not working crazy hard, but yeah, appreciate that.
I have a daughter who's an OB, so I'm going to talk to her about this.
Yeah, I would love people's thoughts, you know, and like I said, when I call them with concerns, they're amazing, right? And I know they're getting those, you know, mostly women back in and all that. Yeah, but yeah.
All right, Robin.
Thank you. I appreciated so much, Rep Reynolds, how you articulated, not only have I been following the Momnibus and the priorities, but the way you articulated the upstream and the reason why we have to look earlier and earlier, and especially at that critical time period, because it's also maybe manageable for us to all rally together across all the agencies who are supporting this work. I love how it's called out in Raise Up Oregon, the overlap and the places of synergy. And also you talked about a lot of health bend, and yet it really will take housing. It takes all of the agencies, private and public, to work together towards the goals. But I wanted to call out how much I appreciated how you described it, and how you described that it's not new stuff, not new things, and yet a new way to look at it, and a new, I would say, I wish you had been here for the first 15 minutes, because Beth spoke about the systems coordination work that's been happening really on fire in the last year, but especially since the Early Learning Council called it out as being a priority to work on systems coordination. And I think, to your point, we've had some of the right components, but they haven't always been coordinated and working seamlessly together, utilizing all of the assets, understanding all of the needs collectively. And so I'm just jazzed about this momentum right now, where I feel like the more of the things on our agenda to come will highlight this as well, which is a moment in time when we really truly, I think, are on the same page. If we can just find that path forward for the next actionable steps where we can all see ourselves in the pieces. I am excited that CCO 3.0 is getting advice from people like you and former Governor Kitzhaber, because I think there's a lot of wonderful things that happened in 2.0, and I'm looking forward to more improvements like transparency and investments in community, back into community, that we would love to see. I am also one of those people who is always going to be a champion for rural voices. And so I have appreciated your open forums. And if there's a way that those of us on the council and in the community can help to bring more voices from rural to those spaces, we will do our job and try to help lift up those unique barriers to rural. So I appreciate that. And I think because we're short on time, I will stop, but I know there will be lots of opportunity for others to give input. But thank you so much for your words today. I appreciate it.
Thank you. And I appreciate, several of you elevating the rural issue. And, I know it's something that Governor Kitzhaber thinks about. And I may have rolled my eyes a little bit on the CCO 3.0, only because I think we're still not sure how or if we're going to kind of get purchase on this conversation. I think, Governor Kitzhaber and I have maybe a little bit different ideas than what is possible with CCO 3.0 from the people who might be some of the folks leading that process. But, I think I continue to, insert myself in those conversations at all levels, including with, the governor's office. And I will just say one reason that we kind of, because there's a bazillion things you could put in a momnibus, right? Including access to daycare, all that stuff. We're also kind of following, what the governor's priorities have been. And she knows that, right? I'm like, hey, I heard you loud and clear, right? And her priorities, of course, have always been I've shared her priorities, not just because I share them because she's the governor, but, housing, behavioral health, all that, right? So we know there's going to be continued efforts from the governor's office and messaging from the governor's office on these sectors of, helping Oregonians. And then we just have to make sure that we are in there, getting the priority for our, this population, put front and center. And I think it's having an effect. I mean, the proof will be in the pudding, but I think it's truly having an effect instead of just one lump sum for housing. And, a lot of the housing dollars go to our currently unhoused Oregonians. And that is so important. Don't get me wrong. But we know that most families aren't truly unhoused, but they're couch surfing, or they're occasionally getting a hotel room, or, and oh my gosh, I can't even imagine how that would feel when you're taking care of a 2-month-old, right? Not knowing where you're going to sleep tonight. So the reading for 40 minutes, right? I mean, how are we going to sit and read to your 2-month-old for 40 minutes when you're literally trying to make every end meet? So, yeah.
Well, thank you, Rep. Reynolds. I'm guessing you're going to run to 10 o'clock is my...
Yeah, I apologize. I would love to stay with you all day. And I think maybe in particular, we'll have to figure out a way to reconnect on the home visiting stuff. I can't remember if we have a meeting on the books, but definitely want to make sure I want to get updated on that in particular. But I know everything you're talking about today. I would love to just sit here and back.
Well, and let me just tell you, Christopher is going to be at the Home Visiting Summit next week, the 3rd. So he will get updated and then can let you know. I have to say, because the council hears about childcare all the time in our communities as well as in meetings, the connection to reducing and eliminating poverty is that parents need to get to work, and they can't get to work if they don't have childcare. So
correct, absolutely.
Put that connection in there, and encourage council members to attend the Momnibus Roundtable on October 10th. I've got it on my calendar, and am very excited to join you with that. And seriously, you are our champion in the legislature, and we certainly appreciate your leadership. So,
and of
one
course,
of the messages that we're taking away today is that a role the council can play is to just make sure that young children and pregnant people are heard, that they're at the table and not on the menu. So making sure that we bring that population to meetings whenever we can. So we will
Yeah.
happily do that.
Great. Great. Well, thank you all so much. What an honor to be in this work with so many true believers and not having to explain things. And you all can, again, I'm very easy to reach. If you have thoughts, questions, concerns, would love to. It's going to be a big list, but we're really excited.
All right. Thank you, Representative.
Take care.
Have a great day.
Bye-bye.
Well, that is a perfect segue into Governor John Kitzhaber, who is on the call, I see. Governor Kitzhaber, thank you for being with us. Thank you for connecting with Rep. Reynolds and her work with Momnibus. We're excited that Lisa and Aaron will be here soon, I'm guessing, but Lisa, good to see you again. And I think most council members have been around Oregon long enough to know that actually John Kitzhaber was sort of the father of the early learning hubs. It was his brainchild probably, 10 years ago, I'll bet. Some of us were at those early tables helping put the whole concept together of how to have the regional focus for community building and delivery of services. So it's especially appropriate to have John Kitzhaber with us today, even though I see that he has fallen off my screen. So I'm guessing he'll be back soon, hopefully. Okay, we are going to start with Lisa and Aaron. Fortunately, John sent us a lot of background information on Upstream, so we're going into this conversation with a foundation of what Upstream is intending to do. And as I said earlier, John has been a supporter, founder, advocate of hubs from the beginning. So the alignment between what this initiative is doing and the prioritizing that council has made of getting hubs resourced and, being more able to do what they were founded to do is perfect. So lots of different alignments here. So Lisa, welcome back. Good to see you again. And we'll just let you, hopefully we can hear you and tell us what you're doing in Marion Polk.
I would love to. I am honored. Thank you so much. For the record, my name is Lisa Harnish, and I'm the Executive Director for Marion Polk Early Learning Hub. And I see Governor is on. I'm connecting to audio. So as soon as he gets connected, I will pause. I'll just do just a couple quick introductory. Oh,
So,
look, I can hear him.
Have I actually arrived?
You have arrived right on time, right on cue. Look at you.
Yeah. I am really sorry. I should not be allowed anywhere near technology without an adult. But I've only got about 10 minutes, so I'll try to get us caught up here. I just do want to say it's really an honor to follow Rep. Dr. Reynolds. I mean, being a practicing pediatrician, she actually gets to see the impact of public policy at the point of delivery, which is a really important perspective, I think. So, Madam Chair, members of the council, for the record, my name is John Kitzhaber. I'm a former emergency physician, Oregon State Senator, and former governor. I'm here this morning in my capacity as the chair of the Oregon Health and Education Collaborative, which is a 501c3 public benefit corporation that's led by education and healthcare leaders from across our state. And I really appreciate this somewhat delayed opportunity to talk a few minutes about our flagship project, which is the First 1,000 Days Upstream Initiative. And as you know, I'm joined by Lisa from the Marion County Hub and Aaron Bardish from the Blue Mountain Hub, and they'll be talking a bit more in a few minutes. Their hubs, by the way, are two of our design pilots, which I'll be describing in a moment. The vision and the goals of the Upstream Initiative are very closely aligned, I think, with the vision and goals of of Raise Up Oregon, the Council Statewide Early Childhood System Plan, particularly to ensure that every child and family in our state has an equitable opportunity to succeed. And the Upstream Initiative, I think, in addition, offers a practical way to actually implement some key elements of Raise Up Oregon, in particular, Objective 3 of the first system goal, which is to leverage hubs and resource hubs to advance regionally developed childhood systems that are equitable, integrated, accessible, inclusive, and family-centered. The work of the Upstream Initiative has been inspired by two things. One, the evolving science about the brain development in children. And secondly, the reality that most of the factors that ultimately determine the success of children and families are ultimately local. So brain science tells us that poor nutrition and maternal stress, both before conception and during pregnancy, can alter the genetic expression in the unborn child, dramatically increasing the risk of poor cognitive functions and learning disabilities and behavioral health and substance use disorders, and the early onset of a whole host of chronic illnesses from cardiovascular disease to diabetes. We also know that the factors that drive maternal stress occur locally at the end of the day, and they are closely associated with the inability of families to meet their basic needs. So what we're really talking about here is childhood poverty, which is important to remember is not an act of God, it is a policy choice. And we're here hopefully to make different policy choices. It's also important to remember that this inability to access basic needs is significantly exacerbated by both racism and increasingly by living in a rural community. Now, by basic needs, I mean not only the biologic needs of food and water and shelter and clothing, but, and I think of equal significance, is for parents to have the time and flexibility to develop the stable, nurturing relationships with their children, which is the foundation of lifelong success. These healthy, safe, early relationships are, in my mind, a biologic need. Early relational health is a basic biological need for human development. In addition to these biologic needs, of course, we need to have access to things like childcare, which you've been discussing, and transportation and healthcare. So when family income is persistently inadequate to afford the basic needs that family needs, the family and the children that live in that family live with the stress of chronic economic insecurity. So think about it for just a minute. Pregnant women and very young children who struggle every single day with the uncertainty of knowing where they can access the most basic of needs, like a shelter, like food, like safety, live in a crucible of toxic stress that undermines everything we know that brain science tells us about the healthy development of children. That's the problem, I think, that we're all gathered here to address today. So the Upstream Initiative builds on two innovative organizations. It's not a new shiny thing. It builds on two innovative organizations that were created 12 years ago in 2012, Early Learning Hubs and our Coordinated Care Organizations, or CCOs. The CCOs were new local organizations with a local governance board. And they were designed to move beyond the narrow clinical model and look more broadly at community health. This was an explicit recognition a decade ago that most of the factors that impact lifetime health status occur outside the medical system and in the community, and often in the very earliest years of life. Now, the vision for our early learning hubs was to bring together multiple community partners to align services and resources to better serve the needs of children and families, and thus help link our medical system, our healthcare system, to the social determinants of health. It's important for us to remember that no other state in the nation has this kind of local infrastructure that for a decade has been building capacity and trusted local relationships. So in my mind, the next step is to more fully resource and empower our early learning hubs to form a closer collaboration with CCOs and with other community partners to focus intentionally on the first 1,000 days of life from conception to age 2. This is the point at which we can have the greatest positive impact on our children. And this is the point where we can have the most cost-effective use of our limited dollars by investing in this very early part of life. The Upstream Initiative is an effort, in short, to provide scalable early learning hub-led models to ensure that children and families have seamless access to the basic needs that we just discussed. The initiative consists of 5 community-based design pilots, 4 of which are led by early learning hubs. In addition to Marion Polk and in Blue Mountain, we have the early learning hub Lane County, and the Yamhill Early Learning Hub. And it's worth noting that the Early Learning Hub of Josephine and Jackson County is part of Southern Oregon Success, a region-wide collaborative that served as the prototype for our other design pilots. And Peter Buckley, who's a member of your council, will be discussing that initiative following our comments. So since last fall, the design pilots have been working with community partners, including their coordinated care organizations, and engaging pregnant moms and families with young children to develop locally designed and locally owned child success models to ensure access to the basic needs discussed earlier. And that access needs to be continuous and without interruption, at least for the first 1,000 days of life, when 80% of a child's brain development occurs. So today we're asking the Early Learning Council, and we as the Oregon Health and Education Collaborative are asking the Early Learning Council to formally embrace and support the implementation of these child success models developed by our early learning hubs, including Southern Oregon Success, as demonstration projects. And we are also asking the 6 agencies that sit with the Early Learning Council to actively support the implementation of these local child success models over the next 2 years for the purpose of not only advancing key elements of Raise Up Oregon, but just as importantly, to demonstrate the effectiveness and the cost effectiveness of these investments in the very earliest years of life. The mission, I think, of all of the agencies that are part of the Early Learning Council will be enhanced dramatically by the success of the Upstream Initiative. So over the course of the next 2 years, the Early Learning Hubs will continue to engage with state agencies and with their local regional partners to implement these individual child success models, which then hopefully can help inform the design and implementation of the Early Learning Council statewide early system plan. The barriers that prevent children from accessing these basic needs are both financial and non-financial. So our Early Learning Hubs and our child success models are seeking innovative ways to create seamless, continuous eligibility for the programs and services that are funded by state and federal agencies, and by directly providing families with the flexible resources they need to secure these basic needs for themselves. And I think our Early Learning Hub and our design pilot in Lane County is pursuing this particular strategy. We also know, and I think this is a particularly important point, that eligibility is not necessarily the same as access. Even if we remove financial barriers, access can be compromised by siloed bureaucratic structures, by uncoordinated providers, and by issues of trust, and by barriers proposed by geography and race and culture and language. Some of the barriers are embedded in this complex structure of public agencies and programs that can at times seem impersonal, sometimes difficult to navigate, and in some cases is not trusted by the very people that these services are designed to help. Now, I want to be very clear here that the problem is not the people who work in or lead these agencies. The problem is the structure of the system itself. And it's no wonder. It's a structure that is trying to bridge multiple levels of government. It has multiple funding streams. It has different overlapping, sometimes contradictory, administratively complex, rigid eligibility requirements that leaves a whole lot of gaps in coverage. And often it lacks the flexibility to respond in a timely fashion to the locally changing dynamics of family need. Furthermore, the agencies and the policies that drive this can change from administration to administration. Yet ensuring that every child and family has an equitable opportunity to succeed requires a consistent long-term investment and strategy that bridge multiple biennia and multiple sessions of the legislature. So for that reason, the strategy has to be so firmly rooted in the community that it can withstand changes in the executive branch and changes in the makeup of the legislature. So what we're really talking about here is the development of local governance or coordinating structures led by Early Learning Hubs with close alignment with their CCOs to ensure that families and children have seamless access to this suite of basic needs. And these structures need to provide a way for all of the public sector and private sector and not-for-profit players, partners, including the 6 agencies that sit with the Early Learning Council, to make commitments on how they're going to contribute to the outcomes that we seek. While the hubs don't provide services themselves, as you know, they do, they are charged with bringing together multiple community partners to better align resources and services. The CCOs, of course, provide a lot of services, but what's important for this conversation is that they are the first entity to connect with many women when or soon after they become pregnant, which gives us the opportunity to identify and try to mitigate the drivers of family and maternal stress soon after conception. And furthermore, and finally, because of this extensive network of trusted local relationships that CCOs and hubs have built up over the last decades, I think they're well positioned, perhaps best positioned, to address the locally specific barriers to access like trust and geography and language and culture. So with that, I apologize again for my technological incompetence, and I will turn it now over to Lisa.
John, if I could just interrupt for a second, Lisa, excuse me. I don't know how long Director Boksaresh can stay online, and I know he has been a really key partner with you, Governor Kitzhaber. So Fair Boards, I just wanted to see if you want to talk a little bit about OHA's involvement. ODHS's, and then Lisa and Aaron will go to you.
Thank you, Sue. Good morning, everyone. Hi, Governor. We naturally, we're very supportive of this initiative. Anything that helps us prevent entry of kids into the foster care system, and naturally, if you're putting investments into building the first 1,000 days that, as John said, helps develop 80% of the development of the brain and the child, we're absolutely supportive of that. We are ready to help with data gathering, with analysis, with anything else that you all need, because from our perspective, this really is the most upstream work that impacts everything down the stream of services that we, OHA, EL, Department of Early Learning and Care, Department of Education, and then ultimately down the road, employment, OYA, all of these things are connected, and to the point that we can really set the foundation right. It provides a great opportunity for this basically a success trajectory. So we applaud the upstream initiative, and really looking forward to hear from Lisa and from Aaron on the work that's happening.
All right. Thank you, Fair Boards. Thanks for being here. All right, Lisa, we're all yours
All right.
for about 5 minutes.
I know. Good morning, everybody. Lisa Harnish, and it has been just nothing but an honor and a pleasure to be a part of the Upstream Initiative. This process and opportunity has afforded us to build new and different relationships with our community, for which I am incredibly grateful. Our work is a design process. Pilot has been illuminating and reaffirming through community circles and family focus groups. We've been able to hear directly from those who are both receiving services and also needing services from our community partners, including our health partners, behavioral health partners, our social service partners, and more, about what is working well and frankly, what could be better. We've been able to work with our CCO, our health county, our health council, and community partners on the data and looking through a demographic lens about our community with I would say renewed energy around what we can do more upstream. Parents have told us very clearly that they feel isolated. They do not know where to turn, and particularly when their children are experiencing special needs or chronic health issues, or if there's substance abuse, behavioral health issues, postpartum depression, it leaves families feeling alone. We also heard that our health partners, our pediatric clinics, often do not know where to turn in the community as well, and do not have the time or the resources to be able to do this. We heard very clear that postpartum depression, we heard about that from Representative Reynolds quite a bit. That struggle is real, and it is also filled with stigmas and cultural views that are, and also we lack the services and the resources to be able to deal with it head on. We also heard that our community health workers, our doulas, our traditional health workers are trusted partners to families. They see them as being ones that they can turn to and are wanting more of that type of service, and also needing them to be highly educated in the needs that families are experiencing, as well as where to turn within the community. We've been able to identify, and you have in the packet our final report that we have produced. So I won't belabor that too much, but we do have identified overarching goals to build a comprehensive perinatal network that meets the needs of families within the first 1,000 days of life. And this really is a shift to more proactive care, stronger behavioral health, relational health supports, stronger alignment and resource navigation to address issues before they become deeper concerns. This is encompassed within the broader view and the vision of early learning hubs as conveners, connectors, and capacity builders. Our design pilot identified 4 major focus areas that we want to and are ready to, and frankly, are beginning to work on even now. One is around training, focusing on a cultural competency training for healthcare workers. Support groups, establishment of postpartum support groups and family circles to better connect families to each other and to other services within the community. The creation of a resource hub, much like we have been able to do for our preschool work, and thinking about the work that we've been doing with coordinated enrollment around subsidized preschool programs, as a way for us to connect families with resources, including childcare, including health, including behavioral health, including housing, food insecurity, and the like. Also, just the real need for technology integration. That's not the solve-all, it's not the cure-all. We have tools that we can do a better job within our community to help ensure that we have resource and referral tracking. Our work is an early learning hub, I will say within Marion and Polk, and I would say across the state, while technically 0 to 5 has predominantly been within the preschool realm. And that is due to some heavy uplift in terms of systems and processes and bringing our workforce together, building that connection between early childhood and our education partners. But we have to do more about the prenatal to age 3 to make sure that we really truly are getting upstream. This work does align with many parts of the Momnibus bill, which I'm incredibly grateful for the work that Rep. Reynolds is doing. It definitely aligns with Raise Up Oregon and many of the strategies outlined there. And so I'm excited to be a part of this work, and I'm confident that you know my stance on early learning hubs and the role that they can and do and need to play within the system of building the perinatal network. So we are invested in this, and we truly stand by you all in partners and in this work. And
awesome. Thank you. Thank you, Lisa. Exciting and quite a beautiful report, I must say. Erin, what's happening in your part of the state?
Good morning, council members. I am excited to come speak with you today. I am Erin Barch, and I am with the Blue Mountain Early Learning Hub, and our area is Morrow, Umatilla, and Union County, as well as the Confederated Tribes of the Umatilla Indian Reservation. And we were so excited to be part of the Upstream Project because our communities, as part of Eastern Oregon, sometimes feel underrepresented. So I'm excited to represent the rural eastern half of the state. In your packet, I'm sure you guys have our child success model with all 5 of our recommendations for our strategies. Today, I just want to highlight a few specific actions that align and support Raise Up Oregon. The first one I want to talk about addresses strategy 5.2.1, which says establish funding for locally designed community-based navigators, and 5.2.3, which is establish a robust network of community health workers in each community. So our communities, like many other communities, have a lot of programs that can help support families, but getting connected to the right program is the challenge. Between eligibility requirements, service areas, funding restrictions, families are left with the responsibility and the burden of navigating those systems. We want to switch that around and make the system responsible and hold the burden to help families. We can do this by ensuring that every family has a navigator prior to birth that helps connect them to the services that meet their individual needs. We see this role being fulfilled by community health workers, knowing that they have great, strong connections with their community and they build that trust that helps families feel safe to reach out and connect to the other programs. To further strengthen the system, we would build a local advisory and community collaboration process, much like the CCO's LCACs. This would be done through regular meetings to support communication between organizations and systems and to identify the successes and the barriers that are coming up. This could also be a pathway to support the use of Connect Oregon and to utilize it more to its full potential in the social service realm. And this can also be a great way to provide information to programs when they're looking for resources, sort of like a no wrong door approach when entities are like, what resources are there? We know there's a lot of turnover in the social service world, and so helping them stay connected and informed is important. Another strategy of Raise Up Oregon 5.3.5 utilize mobile units to travel to where they are needed to increase accessibility to services. This is important in rural Oregon. So one of our neighboring hubs, they recently, the hospital there closed its birthing center. That's a big impact to a community. And closing of services could become more common in the future for rural areas. It's not always cost effective for hospitals to keep services. And as it is, many communities in rural areas are expected to travel 30 to 60 miles each way to access care. And this barrier isn't just about the travel time. There are work schedules, school schedules, childcare schedules, reliable transportation, and then just the general discomfort of being pregnant and having to travel 60 miles each way to access care. Or if you have a new infant and having to put them in the car seat and travel 60 miles each way to access care. Those are the kind of barriers that families are experiencing that could prevent them from accessing care. And it's routine care, the kind of care that prevents risky deliveries, low birth weight, and infant mortality. We would like to see this kind of routine care come to families. Instead of families go to the care come to families. So putting the burden back on the system and not on families. We believe mobile clinics could provide access that families need. This could also allow for more non-traditional hours of care, which is important for people who do swing shifts or who work in agriculture. Also, this could lessen the burden on the clinics in the bigger communities and allow them to see more of their local clients. The next strategy is 14.2.1, expand infant, toddler, early learning and care services. And 14.2.3, expanding access to publicly funded early learning and care services. So between the state and federal funds, we have built a really strong system to provide preschool opportunities to families who are experiencing the impacts of poverty. We've done so well, in fact, that we have a hard time filling slots without going to over-income families. Even Head Start, they fill their over-income eligibility allotment very quickly. Migrant and tribal programs have also had their income eligibility requirements waived by the feds to help ensure that they're fully enrolled. Meanwhile, we have families with infants and toddlers who are struggling to find and pay for care. This lack of affordability impacts the family's ability to maintain jobs and to cover basic living expenses. We would like to see a locally designed option where through community needs assessments and family voice, programs like Preschool Promise, which are state funded, can be allowed to convert those preschool slots to Baby Promise and to support infant toddler programs. Further, this could support families in the continuity of care, which we talk a lot about being really important, allowing them to stay with the same provider from infancy through preschool. and also would allow families who have children of multiple ages to stay in the same provider and not have to find 2 different childcare providers. Currently, our hub has 4 unallocated slots. They're just sitting there in the cloud, floating around, not attached to a program. If those slots could be converted to Baby Promise, they would be filled instantly. We would have all our slots filled, and we wouldn't even have to go to over income. The next Raise Up Oregon strategy is 16.3. Align policies and programs to provide supportive transitions and continuity of services from early learning and care to K-12 settings. So I'm not going to talk about the preschool to kindergarten, but I want to talk about a forgotten transition that happens, and that's when a child turns 3. Because childcare licensing for center-based programs, it states that when children turn 3, they have to leave the toddler program and enter a preschool program. This can cause problems and burden families because there's not always a preschool age program that has an opening for that child. And so now that child might not have anywhere to go. It also doesn't always meet the needs of that child or the setting that they're going into. So for example, if a child is turning 3 in April and they have to go into a kindergarten readiness preschool program with a bunch of 5-year-olds, that might not be in the best interest of that child. What we are recommending is that families and programs have the ability to have a placement meeting, much like how EIECSE has placement meetings. And in these meetings, it would involve parents, the programs that are serving the children, and state licensing. And they can make the decision about what works best for that child and that child's development, rather than having a black and white rule. I would also like to recognize Objective 3, which Governor Kitzhaber mentioned in his comments. And we are here today to talk with you about our child success models because we have partner agencies that invested in this work with the hubs. They understood the roles that hubs bring, that hubs play in bringing local community needs and local solutions to the table. Because of this leveraging and investment, we are able to move forward on ensuring children and families in Oregon that are able to thrive. The Early Learning Council has the opportunity to help ensure that hubs are leveraged by agencies to support informed policies and that empower families, and to ensure that hubs are funded to do the work through cross-agency funding and to continue engaging the hubs when setting priorities. Our region, we are excited to move forward as a design pilot to make the system changes that are needed to support families. We know that what works best for one part of the state doesn't always work best for another part, but empowering local decision-making to support local families, that's the shift that systems need to make to really help support our communities. This work will take time and it will require perseverance, and our region, we are ready to do that. I want to thank you guys again for the opportunity to share what we can do to support children and families through supporting Raise Up Oregon.
Awesome. Thank you, Erin and Lisa. Boy, there is a lot happening out there. So, Governor, shall we just go to Peter Buckley now and then take questions for all of you when he's done with Southern Success?
Unfortunately, I'm going to have to hop off about 11. I apologize for that.
Oh, so are we. I mean, Peter will be done by 11 because then agency directors join us.
Sure, whatever works best for you.
Okay, so Peter, how about, because the governor referred to you as the prototype for this initiative. So what's going on in Southern Oregon?
Well, I really appreciate it. And Governor Kitzhaber's comments about how the Early Learning Hub model and the CCO model coming to bear, it really does impact this work. And that is the story. That's what's happened in Southern Oregon. So Southern Success, we're a collaboration of collaborations. In Jackson, Josephine counties, we've had many people work for many years. In fact, Jim Fong from, he used to be with the Road Workforce Partnership, was one of the persons who helped found, he's on the call here today, to bring this collaboration together, to make sure that we had everybody at the table. So what we are is a collaboration of all levels of education, the Early Learning Hub, K-12 school districts, Road Community College, Southern Oregon University, healthcare, including our 2 CCOs, Jackson Care Connect and All Care, and the other organizations, Southern Oregon Pediatrics, all the folks involved in healthcare. Human Services, ODHS is a key partner of a collaboration, plus all our community-based organizations, the public safety agencies, and workforce development in both counties. And the goal for the collaboration is to make sure every child and every family has a chance to thrive. So Jim and his colleagues, before I got to Southern Success, did tremendous work getting everybody to the table. Our two CCOs contracted with a group called ACE Interface to say, how are we going to do this work that we're mandated to do? How do we go upstream as a region? And their recommendation was to develop an ACEs training team to develop a common vocabulary. So in 2016, we did develop a volunteer-led ACEs training team, employers giving their employees time off to present trainings to schools, to agencies, organizations throughout the region. And to date, we've done over 675 training sessions to just under 20,000 participants in the 2 counties. And this, again, it's across all sectors, getting this information out. We've also been able to help develop the Southern Oregon Family Resilience Project, thanks to some funding from Senator Merkley's office, to expand this curriculum and help train teams that deliver the same curriculum in Coos and Curry through our colleagues at South Coast Together, at Douglas County through Creating Community Resilience, and Klamath Lake County with the Klamath Promise. So in this multi-county region, Southern Oregon, we're using the same curriculum to get out a common understanding of adverse child experiences, the impact of trauma, and the tools for resilience. And that effort has allowed us, again, to develop that cross-sector vocabulary and cross-sector approach to our work together. The key contribution from the Early Learning Hub is the Strengthening Families Protective Factor. One of the first things the Early Learning Hub started to do when they organized in Jackson Josephine was to provide trainings in the Strengthening Families Protective Factor framework. And so we've been able to use the common vocabulary developed through the ACEs training and then the Strengthening Families Protective Factors as a way to organize our work together. And by concentrating on parental resilience, social connections, knowledge of parenting and child development, concrete support in times of need, and the social and emotional competence of children, we've been able to organize our work. In 2020, the collaboration as a whole made the decision that we were going to set a regional goal to make sure that every child has an equitable chance to enter kindergarten ready to thrive. So using this Strengthening Families framework and that regional goal, we have developed the following initiatives, which I'll go through very briefly. I mentioned the Southern Oregon ACEs training team. The team continues to attract new volunteers and continues to do presentations, everything from working with all Providence new employees, get the ACEs training. At our Addiction Recovery Center, we provide ACEs training. At the Oasis Center, we provide ACEs training. So across the board, again, education, healthcare, human services, keeping the same curriculum gets presented so that we have that common vocabulary. We've developed the Southern Oregon Family Advisory Council. This is a group of parents and grandparents from Jackson and Josephine counties that meets once a month. Their current focus is on the family preservation effort with ODHS to really see if we can reduce the number of children in child welfare system. We're really inspired by the work in Klamath County, where they've been able to reduce the number of children in child welfare by 60%, to just concentrating their work on supporting families, helping families. And so the Family Advisory Council, their biggest kind of motto is, how do we take stress off families? What is everything we do to take stress off families? Representative Reynolds talked about poverty, etc. But they focused recently on summer programs. How do we increase access to quality summer programs for families? And we raised some money so we give scholarships to summer programs, just as an example. We have a preschool K-12 alignment work group, which holds 2 summits every year to bring together early childhood educators and K-12 educators to make sure the work we're doing in early childhood is aligned with K-12. So as children move through the early years into K-12, there is an aligned transition, particularly around behavioral health. And this is the group that's really focusing on how do we scale up the pyramid model and how do we align the pyramid model in early childhood with the behavioral health efforts in K-12. We have a group that's focused on increasing the number of school-based health centers. The data behind school-based health centers is very clear. When schools have centers, kids miss fewer school days, they get access to care, particularly behavioral health care. We've been able to develop the highest per capita number of school-based health centers in the state. Our 3 clinics, La Clinica, Road Community Health, and Siskiyou Community Health, they're committed to having a school-based health center on every school campus in both counties as space is available in each district. So far, the Phoenix Talent School District and the Central Point School District do have school-based health centers at every school in their districts, and we continue to expand. We have a parent supports / family capacity for resilience work group. This group is also focused on the family preservation effort in partnership with ODHS. And this group is leading, as Aaron was talking about the importance of navigators, that's come up so often in our work as well. Our Family Advisory Council really points to trusted community partners as the key to families accessing services and successfully navigating systems. So we're working on developing a navigation system, trying to figure out who is doing navigation in education, healthcare, public safety, human services. So far, we've identified 78 different entities that are providing navigation services for families in Jackson and Josephine counties. So we're in the process of trying to organize all the navigators and develop a shared training program for all the navigators. So again, people have a common vocabulary, plus to develop a kind of a drop-in center for navigators to meet each other and know what each other is doing so we can align the services better. We have an early childhood supports work group that focuses on social connections for families. We have a pilot project underway with the Family Hui, which is a great program to actually bring families together for a 12-week program. Our child care policy work group, Governor Kitzhaber kind of inspired this group when we talked about getting health care for early childhood providers. And he pointed out that the American Rescue Plan increased subsidies for health care on the health exchange. And if we could match child care providers with insurance brokers, the insurance brokers can get early childhood providers get their staff onto the exchange for very low cost health care. And the insurance brokers do that for free. So we have a program to do that every fall. Every October, we connect insurance brokers with early childhood providers. We have our youth development work group that works on the next generation of parents to try to align services and resources for children and youth ages 6 to 24. We have a behavioral health workforce group that works on how to expand the behavioral health workforce. We developed a micro-credential in school-based mental health with Southern Oregon University and Southern Oregon Education Service District. And we also focus on how to increase the peer support specialist workforce. We have a partnership with both Rogue Community College and Rogue Retreat. Rogue Community College does peer support work in the mental health field. Rogue Retreat does peer support work in the substance abuse field. And we also have the Family Nurturing Center, our relief nursery, which develops parent peer support specialists. And then our Southern Oregon Caucus is just we gather our Southern Oregon delegation together at least twice a year just to find out what their priorities are and how they can work together to benefit the region as a whole. And I'm really happy to be able to report that early childhood is an area that both Republicans and Democrats in Southern Oregon have worked together on. They worked together to get funding for the Children's Museum, which you'll see when you come down for the retreat. They've worked together to get a school-based health center for Rogue River School District, which was the only school district in our region that did not have one. So that is an area we've been able to bring people together. But our priority initiative is the one that was developed, inspired by the Upstream Initiative. And the Governor Kitzhaber came and did a presentation to our full network in October of 2021 and presented some of the very same information he presented this morning and challenged us and said, if you've set this goal to make sure every child has an equitable opportunity to enter kindergarten ready to thrive, what would it look like? So over 9 months, we used each one of these work groups you see on the page here, and we took a plan. First, the Family Advisory Council, then through each one of the work groups over and over again, said, what would this plan look like? How would we do it? And after that 9 months of planning process, we came up with the Southern Oregon Early Childhood Support Network, which has two main pillars. The first is the Child Care Expansion Fund. No surprise to anybody, every single work group meeting, child care was mentioned as a top priority, even above housing, believe it or not. People said child care, if we can make an impact on child care, will impact more families, and we have to find a way to do that. So our Early Learning Hub, Renee Brandon, who many of you know, has done a fantastic job of really organizing this effort to do the following 4 things that you can see on the slide here. First is how do we expand to rural communities? So Renee has a model of identifying leaders in a rural community, identify if there's a space, a community center, and then developing a child care program at that community center in the manner the community wants and needs it to be. So she's been able to do that with a pilot project and now can scale up that project to other rural communities. And she's raising funds to do that so she can expand that model. And interestingly enough, the first pilot she did is now self-sustaining because it's now being funded as part of the ERDC program. They've been able to reach up to that level. This effort includes sponsorship of child care slots, sponsorship of teacher education. We learned from Central Oregon with their Fast Track program. We're implementing a Fast Track program at Rogue Community College starting in the winter, funded in part by our CCOs. And then specialized supports in childcare classrooms. How do we get the resources we need? Again, working with the pyramid model, working with the infant and early childhood mental health consultant process. How do we make sure this works for all the early child classrooms in our region? And Renee's been incredibly successful. She's been able to raise over $1 million this year towards this effort. There's still so much more to go. Her data shows it will take multi-millions to actually make the impact that we need to do, but she's got it moving in a really great direction. The other main pillar is our Family Success Plan program. And this again came from that idea of the social determinants of health and the Strengthening Families framework. And this came partly from our family advisory group, because their push was, if you could help families make a plan around the Strengthening Families framework and the social determinants of health with a trusted community partner, these are all key things that came from our family advisory group, then families might have a chance of actually, being able to look towards the future of how they're going to actually have a successful family life and how that child is going to succeed. So we developed a plan in consultation with the Family Advisory Council and other groups, and we raised enough funds to provide an average of $1,000 per family to work with a trusted community partner and that family. So the Oasis Center has been mentioned here. So we work with the Oasis Center. They develop a family success plan with the moms they're working with. And then we provide $1,000 to the Oasis Center to invest as the family works with them on what they need in order to address the goals they set in their family success plan. We did a pilot project with 72 families and 8 community partners in last year. All 72 families saw progress. The scale that we measured, because we just had started the program, was the progress in stability and clarity on future goals. And at the start, all 72 families were 1 or 2 on a scale of 1 to 5. By the end, all 72 families were 4 or 5 on the scale of 1 to 5. So we've developed that now. ODHS has come in as a great partner in this work. And so we're expanding this year to over 330 families will be part of the Family Success Plan program. And we've added a pregnancy and post-pregnancy plan in consultation with Oasis that provides a little bit more funds, flexible funds, to really focus on what's happening in pregnancy and post-pregnancy. And again, the key is flexible funds there are so important. The community partners also make a commitment as part of this, and this is based off the Oasis model. They will stay with their families for at least 5 years if the family wants to stay connected with them. So the community partner can help the family navigate services for up to 5 years going forward to make sure that family has a way to move forward. We've also introduced thanks to support from the Ford Family Foundation and others, a way to track long-term outcomes for the families in the program. It's a 3-year tracking process to make sure we have a control group of families who don't do a family success plan or a pregnancy, post-pregnancy plan, and 3-year a control group that does. And we're going to see over the next 3 years the difference in the progress families make. And just really quickly, we're doing follow-up workshops in self-regulation and resilience. But I really just want to point out on the right-hand side some of the changes that have happened in our community. Southern Oregon Pediatrics has been a key partner in this effort. They now ask every new mom how her life was when she was growing up. It gives the doctor a chance to hear about the mom's childhood, and it gives the doctor a chance to say to the mom, what do you need? What do you need to make sure that your baby's childhood is better than yours? And they've hired 2 full-time employees whose only job is to connect new moms with resources in the community to make sure that new mom has a better chance and that baby has a better chance. Jackson County Juvenile Justice has been a key partner. They've done a variety of things. They don't do strip searches anymore. They convinced the county to buy one of those machines that you can, the camera goes around you like at the airport to search for drugs and weapons. They work with kids differently, and they're getting much better outcomes. They used to use restraints on a daily basis. They went for a period last year for 11 months. They didn't use restraints once. Southern Oregon Education Service District has adopted this approach of how do we go upstream? How do we get this common knowledge together? The Rooted in Relationships training they offer to early childhood and K-12 educators has been presented for over 1,600 educators in our region in the past 3 years. And just to point out, the Phoenix Talent School District is really kind of our model in the K-12 world about how trauma-informed practices do to get results. They've developed a culture of connection and support that's just remarkable. And their graduation rate raised up from 67% in 2017 to 95% in 2021. So I just wanted to share that. Again, kind of emphasize 2 points here. One is that Governor Kitzhaber is absolutely correct. It's using the CCO model and the early learning hub and that powerful connection that can make. But also just a comment, when we introduced Raise Up Oregon 2.0, it was one of the representatives, I think it's the current House co-chair of Ways and Means, said, yes, but how do you implement it? Well, the Upstream Initiative is a big part of that answer. This is how we implement Raise Up Oregon 2.0.
Wow, Peter, there's a lot going on down there. I'm glad we're going to be there in about 4 weeks to see some of it. That will be very exciting. Governor Kitzhaber, Lisa, Aaron, Peter, thank you. I'm sorry that it's 11 o'clock, so we don't have time for a discussion, but we appreciate your leadership and the work that you're doing to help support the well-being of young children, pregnant families in the state. So we look forward to hearing more about it and partnering with you in this endeavor.
Thank you very much. Appreciate the opportunity.
Yeah, thank you. Wow. All right. What a morning we've had. Whoa, Bill, Chelsea, Dr. Brown, I hope your morning's been half as exciting as ours. And Andrea, welcome. Good to see you again. Whoa. So we've spent our morning hearing about home visiting and Rep. Reynolds and her Momnibus bill or initiative. And then more recently with the Upstream Initiative that I think most of you are familiar with. So we are very excited to have you here, including Director Paksaresh and Chatterjee. Thank you for joining us. And we're excited to have a conversation in the next hour about what our agency partners' early childhood priorities are for 2025. And I think, as I said in my email, we're not just focused on the 6-month legislative session, but really looking at 2025 as a whole. And I know it's Ledge Days, so it's especially stressful and high demand for all of you agency folks. So I want to say on behalf of the council, we deeply appreciate you being with us. So thank you very, very much. So I think we're just in random order here, but how about if we start, Director Bell, with you, if you would provide us with some overview of your priorities.
Yeah, absolutely. Well, first off, I'll just say good morning, Sue. Good morning, everybody. It's really good to be in virtual community. This is always really exciting. I think, of course, as you mentioned at the top, Sue, of course, all of our collective times are probably in high demand, but I think we are also anchored in making progress in this regard on behalf of not only the people we serve, the families we serve, and also making sure that we are continuing to anchor the needs of the youngest folks in our community and making sure that we're advancing progress that includes and works for everybody. So I'm very appreciative to you and to this committee for just all of the work that you do in your own level of time and commitment. So maybe I will start in not a particular order. So maybe what I'll maybe just start with doing is just sort of an overview and intent of the agency request budget. And I will promise not to get too detailed and put folks to sleep before I have to hand it off to my colleagues. But first, let me just start. I think we all collectively know that the agency request budget that we go through and prepare every couple of years is always about the future, is always forward looking in recognizing that. And of course, this agency request budget process is no different. And in making, I think, our agency request budget, one of the things that has been, just by way of orientation, has been and continues to be really valuable for us is making sure that even though this is a state-driven and state-led process, that we are also doing so in a way that is grounded in community and doing it in a way that is grounded in folks that are working in community and really understand, frankly, far better than we would or I would at the state level of what facilitating progress actually looks like in those communities. And so I certainly want to give a whole host of appreciation, certainly to my team, but also to all of the folks that kept us honest along the way and are really clear and direct with us about what they want to see and what things work and what things don't work. And that really is the culmination of our agency request budget, which is certainly submitted by OHCS, but we very much orient this to also be a bit of the people's budget as well in that. And obviously, just in terms of relationship for the agency request budget to the governor's recommended budget, the whole purpose of the agency request budget is to provide one particular course of action for what progress could look like. So it is an important step in the long step of budget decisions that the decision makers need to make, but it is intended to at least identify one course of action for us to think about and to generate ideas to pull from. So while it is important, it is nowhere near final in that regard. So let me start by just saying first and foremost, part of where we see our role and responsibility as the state's housing agency is to ensure that in all of our work, which is not exclusive to the agency request budget, that it is oriented in a way that is not only measuring success in numbers. Numbers are important. We want to understand where we're at and where we're going. That's certainly true and important. We are also measuring progress in the frame of how people are doing, how people's worlds are changing, how the economy is changing, and then how that trickles down in the day-to-day life for everyday people that we serve. And so first, let me just start off with one of our continuing and steadfast priorities is probably no surprise, but certainly hope continued excitement is around the CARE program. That is one of our really first and concrete and I think important steps to ensure that as we are building affordable housing and continuing to do that, to stabilize families, to ensure that people have affordable housing options in the community of their choice, that we can also stretch and grow and innovate, not just for the sake of innovation, but innovation in a way that's actually going to move the needle forward. So one of our priorities within the agency request budget as it relates to this committee's work is the CARE program, which for anybody that may not be familiar, that is the department's program in partnership with many of you, which increases affordable housing with early learning and education co-located into the affordable housing development itself, with a focus on those that are 0 to 5. I mentioned this before, but I think when the early days of establishing this program, there was a lot of curiosity that I got around why would a housing agency be doing anything with regarding early care and education? And we remind them, Alyssa has the expertise in that. We know how to build and know how to invest in housing in that regard. So that certainly will be an important piece of that, is making sure that we have growing infrastructure for early care and education facilities along with housing. So that continues to be a really important body of work. The other one, which I think is also really important, is I don't think it's any surprise to anyone that housing is foundational and shapes all of our lives. And here in the state of Oregon and across the nation, we don't have enough of it. So we need to build, we need to build, we need to build in all shapes and sizes. And that is also a continued focus of the agency, is to continue to grow the affordable rental housing options that exist across the state. The reason why that is important is because part of the work that we do is not only, as I mentioned at the top, not only the measurement of success in terms of the number of units, but how we are actually building. And what I would draw attention to for this committee is our focus on incentivizing developments that have larger unit sizes for families. I think that is an important acknowledgement that we don't have enough units that with larger that are accommodating for larger unit sizes for families, but also access to green spaces. And also ensure that those resources go towards those types of concepts as well. The reason why that is a particular area of important is we're focusing not just on what we build and how many we build, but how we actually build, which goes into the quality of life. So I think for many of us, we know I grew up in a working class family. I'm sure many of us have that experience and know people in our community that have had that experience. And we also recognize that when folks are operating with lower incomes and have to make tough decisions every day about what can get paid and what isn't enough and what can't get paid, there is also tends to be an impact to quality of life, both around sort of the materials by which your home is built, the quality of your air, but also around energy and climate impacts as well. So being able to think more expansive about how we build. So that will continue to be a really important priority for the agency. The third one is preservation. So over the last couple of years, it's been more recent that preservation is getting more attention, which it used to be one of the areas of the department's work that really didn't get that much attention. And part of it, I think, it doesn't tend to garner the ribbon cuttings like News Supply does, and I get it. And we tend to think it's really exciting and a matter of criticality to actually keep people in their homes. So part of our preservation strategy, our ongoing preservation strategy, is to ensure that the state has not only concerted resources, but efforts and accountability of those efforts so that we can be ready to mitigate a couple of things. The first one is to mitigate when affordability restrictions expire. In plain language, when we invest in affordable housing, you don't get it forever. So we get it 30 years, 60 years, sometimes 90 years. But the department has a substantial and strong body of data to help us forecast when affordability restrictions are going to expire. The reason why that is so important is so many families that I interact with, that we often interact with, often it is a story of having to move multiple times throughout the school year just to be able to obtain affordable housing. So when affordability restrictions expire and they are not maintained, or if the physical condition of those buildings are in poor condition, that very much impacts our families and impacts our children, especially when we ask them to then go be students every day and to then focus. And you can imagine that is an unbearable burden to put on any family, but certainly in a child. And my friends, the good thing about it is we can do something about it. And that's part of our preservation strategies to continue to do that. We have been able to mitigate affordability restrictions expiring for many properties over the last couple of years. We've been able to have a concerted focus on improving the physical conditions of those properties, and we want to be able to continue to do that and continue to do more of that. The third is around rent assistance. So probably no surprise to anyone. Over the last probably 5 years, I won't stretch back to a decade because then I'll maybe pontificate for too long. We just haven't had enough federal rental assistance come down, both in terms of project-based and tenant-based. So project-based rental assistance stays with the unit. Tenant-based rental assistance travels with whoever the renter is over the lifespan of them participating in that program. We don't have enough rental assistance. The reason why that is so important, it's probably the simplest math ever. Rents have gone up, incomes haven't. And so there continues to be significant daylight between that reality. Rent assistance is what helps narrow that daylight and close that gap and make livability more in reach for the families and the people that we serve. And so while it isn't new to the agency request budget, but it has been a very consistent effort of the department, which is to ensure that we can have rental assistance resources to be available to folks so that they can choose where they have a place to live, and also to help make that goal of affordability within reach for folks. I think what's really important and may be interesting for this body is we also had for the first time a youth rental assistance program. It was in terms of scale, it was small, but I think what was important about an important learning from that, and we can certainly come back and share more objective and concrete learnings of it, but being able to have a youth rental assistance program. And that is really important because when we look at the experience of homelessness and all of its manifestations or housing stability, we tend to see a couple of really important trends. And one of those is that oftentimes that housing stability started when that adult was a child or was really, really young. And so our objective, both as not just an agency, but I think as the totality of an executive branch, is that we aim to be more upstream and figure out where we can mitigate that heartbreak of eviction, mitigate that heartbreak of housing instability as early as possible. And this is one of the important ways that we aim to do that. And then maybe the last thing that I will mention, at least for now, and I won't go into too much detail, but certainly continued partnership with our good friends here represented with Dave Baden around the 1115 waiver, which through that collective leadership, and we are spending so much time together on that implementation, but we think that is an important area of important integration that I think people have and continue have and want to continue to see, not only from their state agencies, but also ensuring that that integration and partnership manifests at the local level. So where we can both bring not only rental assistance and additional services to bear, but we are doing so in a way that honors that when individuals and families are in need, oftentimes there isn't just one need, particularly if they are housing unstable. Oftentimes they are then energy burdened and or water resource burdened and or other burdens. And so we want to ensure that we can have a response that's meeting the cacophony of needs. And frankly, just I think a better practice of effective integration. And so I want to offer of course, my acknowledgement for their leadership in that regard. So with that, I think that rounds out, Sue, where we see our most stark opportunities and of course, priorities to continue advancing our work of that we are in together. So I will yield to see if there's any comments or questions and or just turn it back to you, Sue.
All right. Thank you very much, Director Bell. And I think we all appreciate the fact that you have a very global, inclusive look at families. You aren't just putting them in a place to sleep. So that we really appreciate that perspective. And also I want to thank you very much for both Chelsea and and Mitch's involvement in our support for implementing Raise Up Oregon. They are key players, and we really appreciate you enabling them to invest their time in working with us. So thank you for that. Council, I think what we're going to do is invite our other agency representatives to speak, and then we'll see if we have any time for discussion after that. So let me turn to Fairbors from ODHS, who is with us still. Thank you. And I see that Bill Bainey is also with us. Welcome, Bill. Good to see you again. And Dr. Brown is here. I just can't see him, but welcome.
Thank you, Sue. Again, good morning, everyone. Great to be with you. As Sue said, Bill Bainey will be presenting for us today. There's a lot happening in ODHS in support of ELC and DELC, early learning. That's really important to us in this agency as we do our work. Due to time limitation, you'll get just a few examples of the work that's happening, and we'd be glad to follow up. We can provide more comprehensive picture. Our collaboration with and the support of ELC and DELC. What Bill will share with you is some of the work that we're doing to expand our family preservation efforts, which is focused on supporting families at home and preventing kids from entering the foster care system. Our family preservation also supports early learning and early childhood through keeping families together. You'll also hear some of the work that's happening. Peter already spoke about that. We work very closely with our partners, community-based organizations in Jackson County. There are lots of great community-based organizations down there that are doing amazing work at the ground level. Bill will also share with you some of the work that we're doing around economic mobility and well-being. Also, again, everybody's working with Dave and his team in OHA around the implementation of the 1115 waiver. Again, in the 6 slides that's coming up, there's a ton of information in that. I'll stop and turn it over to Bill to go through the slides.
Thank you so much. I appreciate that.
Welcome, Bill. It's good to see you again.
Sue, it's good to be seen. Thank you so much. Thanks for the gracious welcome. So as was outlined, the information I'm going to be sharing today is really a small sampling of some of the really wide-ranging efforts that are being taken within ODHS in support of young children 0 through 5 and their families. And so, again, I think a lot of the things I'm going to be speaking to, tie not only into the governor's agenda, tie into ODHS, and also Raise Up Oregon. And collectively, I think all of these things are stitched together. And so as we're moving through this, you'll see that common alignment through all this information. So we can go to slide 2, please. So as outlined, family preservation, I think, has been a tremendous kind of project that's been moving forward. Over the past year, we originally started with 3 different sites around the state. And so we've moved from 3 sites out to 8 sites within the state. And as this work has progressed, it's deeper connections that are being made with the communities, with the tribal nations, with self-sufficiency programs, and really ensuring that we're able to proactively further upstream provide the supports necessary for families to keep families together, to really proactively support them with their stability and well-being. And the work that we've been doing on family preservation in terms of the collaboration between self-sufficiency and child welfare is just one example, but it's truly the partnership we're having with our community as we're doing this work. We can go to the next slide. And as we're talking about our partnership with the other programs in the area, I just want to call out a few examples that just maybe illustrate some of that. One, I'm sure that Peter probably chatted about this and knows a lot about this stuff as well, but some of the relief nurseries right now in Klamath and Multnomah counties, they're really focusing some of their resources through family preservation to work with families and support the early education and kind of the early child experiences for that entire family system. And the relief nurseries are a tremendous partner in doing this work. The Wolfpack, located out of Multnomah County, is really implementing more of a Native American focused therapeutic intervention. And this is really for little ones that are not being successful in the preschool setting. So the intervention has been lowering suspension and expulsion rates and for children that are needing a much more therapeutic approach to some of the behavioral needs that they're having. Really positive, really effective. CAPTA, which is the Child Abuse Prevention and Treatment Act, really requires that states that are receiving those funds to have kind of procedures and provisions for referral process for children that are involved in any sort of substantiated child abuse or neglect. And so what services are going to be available? So right now, child welfare giving guidance to the caseworkers that are working with the family is that if there are developmental concerns that are identified for a child under the age of 5, during kind of a CPS assessment or even an open case, a referral to a kind of EI, early intervention, early childhood special education kind of can occur, even if there's no founded kind of allegation of abuse. And this more proactive approach about really getting little ones to services and getting connected to services as quickly as we possibly can is much more of a proactive kind of further upstream approach. So with this, obviously with the CAPTA referrals, it necessitates MOUs between local child welfare branches and the ESDs. And as these ESDs and child welfare branches have been going through the MOUs, I think there's been kind of recognition to do a critical assessment of the existing practices and the existing MOU to make sure that it actually is relevant and current. So in Douglas County, they're using kind of that as a model for how this practice of developing an MOU to improving collaboration, what the referral process is going to be doing. And as that model is being used, that's going to be generalized to other areas around the state. So it's a tremendous opportunity to learn from one of these family preservation sites about how this connection is being made. The last one I'll speak to as far as example is really around the safe sleep. And so with Safe Sleep, I think there is the recognition of providing this information for the folks that are connecting with families. So child welfare has been increasing a lot of the training and supports using some of the CAPTA funds around safe sleep practices and really how do we help families with education, outreach, and awareness, and what does that look like? So really a tremendous partnership. We can go to slide 4, please. So one of the things on Raise Up Oregon, it's, one of the things I've been fortunate as far as being involved in Raise Up Oregon, not only the first iteration, but the second iteration, and seeing the evolution of this too, which has been tremendous. But one of the strategies, in particular around strategy 2.7, which is really expanding to housing and nutrition, climate-related sports as part of the 1115 waiver. So right now, we have been really actively engaged in some of the work with the 1115 waiver. As Director Bell mentioned a moment ago, just really calling out OHA, and I think the work that OHA is leading in the partnership and the collaboration. Our Oregon Eligibility Partnership, the OEP, is really prioritizing some of the work in one for continuous eligibility and to ensure the other needs of implementation are specified by using some of those demonstration waiver funds. Policy leads from ODHS are actively involved in some of the implementation work groups that are really kind of partnering with OHA to ensure there's all effective coordination, all policy considerations, everything around a shared populations for families, so that the waiver is actually in place to provide the support necessary for the families that we collectively serve in a much more coordinated manner. For youth with former or current child welfare involvement, really is being called out as a priority population in the waiver. So child welfare has really partnered closely to lift the needs of those children and youth to strategies to make sure they have the access to those services that are under the waiver. ODHS continues to provide the data and the information regarding the individuals across all of our programs, be it child welfare, SSP, APD. So making sure that all those folks that are connected are eligible for some of the health-related social needs benefits that are going to be connected with the waiver. The next phase of the work is really working with local leadership. And by the sake, local leadership, we're referring to local ODHS district managers and their efforts to work with some of the CCOs to really look much more intentionally about what's the best strategies to support the youth, the child, the family that are connected to that family preservation. And I think that's going to be one of those priority areas. How does 1115 waiver support some of the family preservation work? Because that truly is much more of a collaborative, much more effective work that's really cutting across all of our programs. Slide 5, please. So one of the things that we've been talking about in terms of the strategy also with Raise Up is really promoting services that are more accessible in the communities. And so as we are looking about accessible services, part of that is community integration and some of our mobile teams. So right now we have some model for integrated mobile team that's working with community partners to try to kind of address the gaps, improve customer service for the populations, to make sure the barriers for access are removed. And some of that is really accessibility. So to really move that forward, we have really put an emphasis on priority populations, for instance, families in recovery, and also families that are experiencing houselessness. To give you an example, in District 8 in Jackson and Josephine County right now, there's a small team that's really comprised of a supervisor, some service partners, meaning for us, we call them family coaches. We have an eligibility worker. We have a case aide, for instance. And those teams work very closely with the community partners. So it's really working very intimately, sometimes embedded with the community partner, as a matter of fact, sometimes kind of connected with that community partner at the location. And really trying to work much more effectively. So it's going to where the community is, as opposed to asking the community to come to us. And what do we do to make this more effective? And really building on the trusting relationship and the rapport that these community partners have with folks. There's an example I would call out, for instance, an Oasis Center, and that is families that are in recovery. Right now, we have some dedicated staff that are stationed at Oasis Center to really improve that kind of access to those services. Another one in District 8 would be some of the work happening at a Rogue Retreat in the Maslow Project. And those are kind of folks that are experiencing houselessness. And we have a kind of a staff person that's regularly partnering with direct outreach efforts to meet with the people that are experiencing houselessness where they are. Again, not asking folks to come to us. We're going to them to really be much more proactive in the way that we're getting those services out. And the last one I would call out would really be around the Pathfinder and Jackson County Community Justice. And these are kind of women and gender diverse people that are involved with the justice system. And so this is using a community-based organization that's currently in place. The organization is called The Collaborative, and that's kind of a hub, if you will, of all of these services. ODHS staff do the outreach to these folks actually within the collaborative just to increase access. And building on the relationship and the trusting rapport that they have with the collaborative, that location, it increases access not only to ODHS services, but other services that that ODHS family coaches and others can help be that connective tissue too. So it's a tremendous linkage to some of those services, even outside of ODHS. We can go to slide 6, please. As Director Fairweather said, this is a lot of information. So please feel free to ask as we're going through it. I'm mindful of my time, so I want to make sure I tackle it all. The last one I wanted to call out is really around the economic and concrete supports. As folks know, it's really inseparable for some of the child welfare outcomes, really ensuring that the well-being of children and families, proactive, further upstream supports really decrease at times the levels of acuity, one of those being further involvement with child welfare. And so how we're able to really ensure that families have the stability, economic stability, some of the concrete economic supports necessary to really foster that level of well-being and family stability, it's kind of critical as we're moving forward. So we've been working very actively and trying to move some of our policies, some of our practices further upstream. For instance, I'll give you a couple examples I just want to call out. One, there has been an end to full family sanctions, which has been very important. I think other states around the country have been doing it, and we put an end to that. We've increased the DVS grant to 3,200, which is a tremendous increase based on where it was in the past. And actually, this is long overdue, and we're just thrilled to have that level of support. There's also been an increased rental assistance to Afghan placement program refugees, roughly 97% of them. And that number constitutes roughly about 370 households with an average about $1,000 per month that they're getting. And again, proactively getting those services out to folks as quickly as possible. And the last two I would call out would be a $10 million investment in the Oregon Food Bank and a $4 million investment in Double Up Food Bucks. These are just a few of the examples of really what we've been doing as an agency to really further the agenda about strengthening children and families, really proactively and collaboratively, not only within ODHS, as I said, but this really necessitates collaboration with our partners being the communities we're serving, the families, the state partners, and also the local CBOs that we're connected with as well. So I just want to call out, it's been a real kind of pleasure and actually a side product of doing some of this work with Raise Up Oregon and the Early Learning Council has been deepening collaborations with our respective agencies. And so this work may be tied into Raise Up Oregon, but from the work that I've been doing, the work that I've been affiliated with, it's actually deepened my work and actually deepened the connections that we have and strengthened the resources we have for the families that we collectively support. So I just want to say thank you, and that's all. I'll leave it there. If you have any questions, or Fair Boards, if you have anything you want to add to that.
I think we're out of time, Bill, but hey, thank you. Again, please reach out. Like Bill said, there's a ton of stuff happening, and this happens in collaboration. Most of the work is happening with the community, in the community. We're really just providing support. And Peter, I think, highlighted that. So we appreciate the partnership.
Yeah, I mean, this is like a new world for ODHS, just in my brief 2 decades of working with you, some of your folks, predecessors. So congratulations and thank you. Thank you for focusing on keeping kids home, and community support wraparound services is awesome. Next, let's go to Dr. Williams. Thank you for being with us again. It's always good to see you and get updated on the great work you and your staff are doing.
Good morning, and thank you, everyone. Really, really appreciate the efforts that everyone's doing in terms of really trying to help our early learners. And I'm always going to continue to give a shout out to our team members who help, just equip us for this conversation and presentation. Carrie Williams especially takes the lead on a lot of our early learning work inside the department. I also just want to call out just the partnership across agencies that happens, collaborating with the Dell, collaborating with OHA, all the collaboration that it takes also to make sure that we provide more coherent, coordinated services to our families. And so just I thank you for the opportunity to share priorities today. And so with that, I'll launch into how we've identified our priorities, because at the Oregon Department of Education, we have 12 objectives and 37 strategies in that Raise Up Oregon plan. And while all of them are vital in building a robust and equitable early learning system, we've identified our 3 that align most closely with our current focus and ongoing initiatives. These priorities represent areas where we believe we can make the most impactful contributions to the success and well-being of Oregon's youngest learners. So our first priority is Objective 13. Young children with developmental delays and disabilities are identified early and provided with inclusive services to reach their full potential. Because this priority this not only demonstrates our commitment to equity, but it reinforces our goal of fostering a truly inclusive learning environment where every child can reach their full potential. We know that early identification and intervention are absolutely critical if we're going to mitigate the long-term impacts of developmental delays and disabilities. And we know that this early identification is essential in building a strong foundation and increasing their capacity for achieving equitable outcomes. So some of the key activities that we're doing at ODE include the Oregon Early Childhood Inclusion Initiative, which supports the inclusion of young children with disabilities in early learning settings. We promote best practices in inclusive education, and we strive to eliminate barriers that prevent children from accessing quality inclusive learning environments. So starting very early on, making sure our youngsters are included in that inclusion initiative. The speech language pathologist stipend program provides stipends to encourage the recruitment and retention of qualified SLPs in Oregon to ensure that children with speech and language delays receive timely and effective intervention. So just all we can do to recruit and retain staff, especially with these specialized skills, is vitally important to supporting our early learners. Our second priority is around Objective 16. Children and families experience supportive transitions and continuity of service across early learning and care in public education settings. And I believe we had visitors from ESDs or districts last time just talking about how important those transition partnerships are for our youth and our young learners. So we want to make sure that we create a seamless transition for children and families as they move from early learning environments into our K-12 education system. We know that this is vital to their long-term success. We know continuity of services and strong partnerships between early learning and public education are essential if we're really truly serious about supporting our social, emotional, and academic development. So some of the activities that we have been engaged in to support this second priority is the development of resources to promote smooth transitions to kindergarten, alignment of our early learning and K-12 standards, professional development for educators, and family engagement efforts that provide families with the information and support they need to navigate this transition successfully. We have our early literacy grant funding to support language and literacy development from pre-K kinder through the early grades. This funding supports targeted interventions and professional development for educators, helping to create that bridge and help bridge the gap between early learning and K-12 literacy instruction. So we know early literacy is a priority of our governor, is a priority for our agency. It's just foundational for our students to learn and thrive in our K-12 system. Our third priority is around Objective 12. Families have access to high quality, culturally and linguistically responsive birth to 5 social and emotional supports. So with the growing recognition of the importance of social emotional learning in early childhood, we're committed to expanding access to high quality, culturally and linguistically responsive social emotional supports for our children. These supports are critical in promoting children's mental health, their resilience, and well-being, and laying that foundation for success. So what does that look like? We've adopted the TESOL standards, which are the transformative social and emotional learning standards that are inclusive, they are equitable and responsive to the diverse needs of children. These standards are designed to guide educators in creating learning environments that support the social and emotional development of our students, with a particular focus of those who've been historically marginalized. Continuing to offer the online development screening that supports families and early educators to conduct developmental and social emotional screenings for our young children, because early screenings help identify children who may need additional support, allowing for the timely intervention and support they need. And we know when children feel safe and they have that supportive environment, they are more likely to learn and thrive. So those are our priorities. Happy to.
Thank you very much, Dr. Williams. They have certainly been topics of conversation at many, many council meetings. And we will continue to help push for support for the variety of programs that you all are running and administering. So thank you. And thank Kara for us. She's a great partner and a great part of our implementation team. So thanks for that support. Let's go to OHA, which we keep talking about. And Dave Baden, thank you for being with us again. It's good to see you again.
Yeah, thanks. Thanks, Sue. Thanks, everyone. Dave Baden, he, him, pronouns, Deputy Director at the Health Authority. Dr. Hoffey is on the road in Eastern Oregon today, visiting with some local community partners on a variety of things, and sends her regrets for not being able to be here today. Yeah, I'll try to be brief so that we have some time, hopefully, for some questions. I did want to sort of similar to others, do a good link with Raise Up Oregon priorities into both OHA's strategic plan and where we are in the legislative process in putting some priorities in place. So next slide. So I did want to point to, we published now the OHA 2024 to 2027 strategic plan, which I think we had talked about before, really firming our commitment to the strategic goal to eliminate health inequities in Oregon by 2030. It's one of those hairy, audacious goals to really look at how the whole health system, upstream and downstream, really is focused on eliminating health inequities in children, health inequities throughout the state in all areas. This is grounded in 5 pillars. I tossed into the chat a link to the strategic plan if you have not perused already of the 5 pillars that we're really working on to try to get there and really focus. And there really are a lot of areas, especially in the fostering healthy families and environments set of our goals, that aligns, I think, really closely to the Raise Up Oregon work. And we'll do a sort of a crosswalk here in the slides to come, and then I'll talk a little bit about a few of our policy option packages, and then leave time for Alyssa and others. Next slide. Again, so the it's sort of looking through the objectives in Raise Up Oregon. I think just for us, and just a shout out to Kate Wilcox and Liz Stewart and Chelsea Holcomb from OHA. I think Kate's on today for helping really focus and keep the agency moving a good solid direction to keep that focus on kids and early learning. And there's just a lot of spots around the agency. Obviously, the work on the 1115 waiver that Andrea and Fairbours both mentioned, of keeping us focused, of moving Medicaid more upstream, whether in housing, nutrition, or in climate supports, and also of moving forward some new work in youth and health, youth with special healthcare needs, those that are sort of would be aging out of the CHIP system, trying to keep them with solid Medicaid insurance so that they can keep their providers in support. So just wanted to highlight a couple of areas that we really be focusing on around the Momnibus legislative concepts, and how OHA is part and can support things there. We talked a little bit about housing and nutritional needs through the waiver. We're really getting close to the rolling out of the first big piece of our housing initiative, the 1115 of the waiver, which is up to 6 months of rent and other sort of move-in and other supports, focused on keeping people housed, really focused on those that are at risk of losing their housing. Andrea talked about a lot of other supports and work that OHCS and counties are doing across the state, trying to find that sweet spot for the waiver, and where we're starting is using that rental support to keep people housed. And really trying to create good links between CCOs and local organizations to make that happen. Excited to see the start in November, and see will be a process to get started and see how much we're able to support folks and link them to other services. I think those wraparound supports are super important. We've talked a lot in here before about universally offered home visiting programs. We do have a policy option package to solidify that as we're going forward. Next slide. This clearly on objective 7 around all families have access to support for their physical, social, emotional, behavioral, and oral health is really almost a restatement of our strategic plan pillar of access to affordable care for all and transforming behavioral health. So those two pieces, we've talked a lot about the importance of continuous enrollment in the Oregon Health Plan. That's fully live. Again, where we are sort of in the process of redetermining eligibility for Medicaid, we pretty much are through that entire process. And so that the impacts of continuous enrollment are gonna start being felt now and over the next year, of where people that would have had to have gone through as an adult for an annual now have 2-year, but we now have kids that have 6-year eligibility or up to age 6 that are now on the health plan and will continue to be on the health plan. And just the monumental change in that of just having continuous access, regardless of moving, regardless of other things that happen. I'll talk a little bit about one of our policy option packages around traditional health workers, which includes some doula hubs, which is a new concept that we're asking for legislative support should it get into the governor's budget. And around CCO incentive metrics for social emotional health and assessments for children in ODHS custody. Again, all of that is, I think, so important in supporting the objective that is listed here. Next slide. And again, objective 11 around access to high quality, culturally, linguistically, and responsive birth to 5 pediatric healthcare services. I just mentioned the continuous enrollment period that we have in the Oregon Health Plan. And again, very closely aligns to the strategic pillars. Doula work, we have some universally offered home visiting, the Family Connects Oregon program, a policy option package to solidify and make sure that there's continuous funding for that work. We have implemented some enhanced payment for culturally and linguistically specific services provided by traditional health workers, helping assure that that we are appropriately paying and incentivizing that work to be happening. I think know how important that traditional health workers and community health workers are out there. Next slide. I won't go through sort of all of the individual policy option packages. I think as Andrea was talking about, I would say that our policy option packages that we're putting forward are more streamlined and a little bit maybe smaller, I'll use, than maybe past agency request budgets, working in sort of an environment with Governor Kotek to assure that what we're putting forward is a little more closely aligned to a balanced budget. One I did want to highlight around the kids integrated delivery in schools. There's a lot in that particular policy option packages. It's one of our sort of bigger policy option packages to fund. There's just a lot of really, I think, important expansion. So there's sort of about 5 aims in that one, which is school Medicaid billing, assuring that we're maximizing Medicaid billing for school-based health services, some expansion in mental health services through school-based health center program, as well as the school-based mental health program, focus on culturally specific youth suicide prevention efforts out of our behavioral health division, and also building some better capacity to coordinate and align our work with ODE, with Dr. Williams and her staff and other state agencies. That is, again, one of our larger asks of general fund is that, and I think it's just super aligned and shows sort of the priority that the agency is trying to put forward around sort of our kids' work there. Next slide. A couple of others around additional behavioral health investments. Clearly, there is not enough residential behavioral health capacity in this state. That's even more acutely true for kids. So we are asking for, in our agency request budget, for additional facility money to continue to try to lessen the gap that is out there for how much residential units for kids and family as well. I think Fairbours and team talked about the importance of home and community-based services. So we have some additional resources to sort of shore up that work within OHA as well. Next slide. Last but not least, we have a few legislative concepts that I think are really closely related to ELC's work here as well. Strengthening the system of care advisory council, Anna Williams and her group, of making sure that that's strong and has a good set of things. There are clearly some gaps in our tobacco prevention programs around certain products that are out there. So we are pushing a legislative concept there. And then a couple of other children's health and blood spot screening programs as well. Summary of our legislative concepts. There's actually some really helpful summaries for what we're trying to get done. We'll be updating that as legislative language we get back here over the next few weeks. And, you know, just look forward to getting ready for session and keeping a good focus on the work that you all are doing and, you know, supporting things as we get into the legislative session.
Wow, Dave. Yes, a lot going on. I see why your name was mentioned by just about every other director. You're obviously partnering everywhere.
That's the goal.
Well, it's very impressive that there's so much cross-agency partnerships that we're hearing about on this call today. Very encouraging. And I want to now invite Alyssa, if she would give us a DELC update. Welcome, Alyssa.
Thanks, everyone. Good. Still morning, barely there. Good morning, everyone. I think Gabby's going to pull up some slides. Thanks, Gabby. You can go to the next slide. So I wanted to kind of ground us in the strategic plan that DELC launched, our first agency strategic plan, which we've called Growing Oregon Together. We're really intentional to build off of Raise Up Oregon. There's actually a whole appendix that crosswalks our Growing Oregon Together strategic plan with Raise Up Oregon. But there were 6 goals that we identified here. The first was access to the type of care that families and children need, centering tribal sovereignty, really calling out the need to support families with infants and toddlers, supporting our workforce, deepening our relationships with community as a new agency, and as a new agency, really having the foundations we need to be able to efficiently serve folks all across the state. And so we took these goals, and as folks have been talking about ARB, really tried to map them to future work. And as Dave mentioned, agencies are really trying to be cognizant of available resources. And so most agencies were given a 1% cap for general fund requests, which for DELC was a cap of $6 million. And so we've asked for a few things, but what we'll walk through today is really trying to focus on how we can leverage existing capacity, resources, and authority to further the goals of Growing Oregon Together and Raise Up Oregon. But we will be, we have put forward in our agency request budget, thinking about that staffing, or sorry, that foundations goal 6, and making sure we have staffing for our preschool promise program to ensure quality assurance, having accounting techs for the 900 plus invoices we receive each month, and maintenance costs for systems like our new awards management system, the Healthy Families Oregon database. We also are hoping to leverage federal child care and development funds to increase our licensing capacity to get closer to best practice caseloads for our staff as we hopefully continue to grow the availability of childcare across the state. And the last piece, which was outside that 1% cap, thinking of the governor's priorities, was increasing access to early literacy resources and supports for families and educators. So that's sort of what our ARB frame is. And if you go to the next slide, what we've done is really looked at even within existing resources and ongoing bodies of work where we see those connections. And so Raise Up Oregon Strategy 1.3 is to promote and preserve tribal culture in coordination with the Oregon Tribal Early Learning Alliance. So we are working on developing a tribal early learning plan with the Tribal Advisory Committee, which they are recommending replace the Tribal Early Learning Hub. We also are establishing DELC's tribal consultation policy to dictate how we as an agency engage with each of the 9 federally recognized tribes within Oregon's borders. Raise Up Oregon Strategy 1.4 is to dedicate portions of programmatic funding to ensure tribal nations have access to resources. And so we've begun to operationalize set-asides or funding opportunities, non-competitive funding opportunities within the birth through 5 literacy resources. And so tribes are able to request up to $200,000 through the birth through 5 literacy program and the Early Childhood Equity Fund. And then we're in the process of opening a notice of intent for folks to be able to tell us how many preschool promise slots they would want amongst the tribes. And so this is just the first piece, but really working at leveraging our Tribal Affairs Office to continue growing our government to government practices. Next slide. The other piece we're looking at is Raise Up Oregon Strategy 2.4 and focusing specifically on literacy development standards and practices. So we are in the process of designing the birth through 5 literacy plan that will be released at the end of the year by really focusing on community engagement this fall and understanding what's been working well in community and where there's gaps in our existing structures and resourcing to inform, hopefully, future investments in the 2025 session. This also includes working with the Department of Education's early literacy framework and dusting off the early learning and kindergarten guidelines that our team developed with Kara in her previous role at ODE to really expand those guidelines to be inclusive of infants and toddlers and have a more robust literacy component. Another piece that we think is really important and we'll be working on with ODE is the technical assistance and support for educators in the early years and early grades, because when we rolled out the last guidelines about 8 or so years ago, it didn't come with any of those supports for the educator workforce. And so that's another component we'll really be focusing on over the next year. Next slide. Raise Up Oregon Strategy 14.4 and Objective 15 are really focused on the workforce. And so both of these are related, improving professional development opportunities and ensuring that the workforce is diverse, culture responsive, high quality, and well compensated. One of the major vehicles that we're leveraging for this is House Bill 2991, which really focused on barriers to the early childhood workforce. And so this, we are in the process now of convening the work group that will be reviewing these. Secondary research has been concluded looking at over 75 different resources and documents, and the primary research is underway, and this will be inclusive of compensation as well as access to higher education, professional learning supports, improvements to our professional learning structure and licensing and registry systems, as well as the diversification of professional development opportunities and providing more resources in other languages and centering culturally responsive practice. So these are some of the big bodies of work that we have underway, but by no means an exhaustive list. These are the kind of 3 big ones, but we also heard through our community engagement in budget development the need to continue developing the early childhood suspension expulsion prevention program in preparation for that 2026 prohibition. We also will continue to work on managing the employment-related daycare program. We also have been working in consultation with each of the 9 federally recognized tribes on better ways to more intentionally resource tribal nations and help them meet their goals for early learning and childcare in their communities, as well as increasing access and services, particularly for infant toddler care. So wanted to stick with the 3, but also wanted to lift up some of the additional needs that we heard surfaced over the last several months. And I think that's my last slide, but I'm happy to answer any questions.
It is. That's your last slide, Alyssa.
Thanks, Gabby.
Thank you, Alyssa, for the breadth and depth of all of that. Okay, council members, it's actually right at noon. Before our director partners leave, I just want to mention, and this may already be on your calendars, the council 2-day retreat is at the end of October, and Wednesday, October 30th is from 10 to 11:30 is the time that we hope you will join us. And you could join us in Ashland and see all the wonderful things we've been talking about in Southern Oregon, or obviously virtually. But we would appreciate having your input at that time. We'll be trying to finalize and discuss council priorities for 2025. So we're obviously working with your staff who are part of our RUI Act agency implementation team. So you'll be having lots of input between now and then, but we hope people like Bill Bainey will also show up somehow, because we always appreciate your input, and Chelsea and Kate. So I'm sorry, I don't think we have time for questions and discussion unless any agency staff can stay on a little bit longer, but that was not what was on the calendar. So those of you who need to leave to go to another meeting, we thank you very, very much for your time and commitment to this work. All right. Yeah, Chelsea, it's good to see you again. We talked about co-location, I think about 10 years ago, no, 5 years ago, maybe at some conference in Woodburn, right?
Yeah, we had, that was at the, that was really the first time that we brought folks together to have kind of an initial conversation. That was the Build Early convening, and you're right, it was in Woodburn. It was a really wonderful one-day conference, and I think about that a lot as the CARE program gets implemented. So we've come a long way, and we're just getting started. So it's always great to be here and really appreciate this partnership.
Well, thank you for sticking with us and partnering, because I don't think the CARE program would probably be in place without you. So we appreciate your tenacity and your leadership.
Thanks, y'all. I really appreciate that.
Yeah. All right, council. We had anticipated maybe staying on with directors till 12:15. Obviously, they're all running to other appointments. So after our break, we're going to have see if there's any public comment. I don't think, Gabby, we've heard in advance that anyone is wanting to speak. Is that right?
Yeah, that's correct. So I haven't received any notices of written or intent to provide verbal comment today.
Okay, great. Thank you. So then the idea of the debrief after we take our lunch break is that we're going to have all of 20 minutes, unless you're willing to come back a little early from lunch, to debrief the morning and what we've heard, you know, what priorities we've heard from all of our agency partners, what priorities we know from our own community involvement, to try to start addressing what we want to send to the governor as far as what we would recommend she include in her early childhood agenda. So it is 12:04. Are you all willing to come back at 12:20 12:20 instead of 12:30, so we have a little longer to digest and try to figure out what we're going to say to the governor. How about if we do it this way? Those who are able to come back at 12:20 will start the discussion. If you've got other commitments and can't get on till 12:30, that's fine. We won't be done by 12:30. So you'll still have lots of time to provide your input. But let's come back at 12:20 and start diving into what we've heard this morning, all of which was incredibly exciting. So, okay, thanks. Thank you, Gabby, for running this meeting.
Yeah, and just a reminder that the live stream is up and going, so please make sure that you're muted and your camera's off, and I'll pull up the slide right now for folks, indicating that we're on break.
All right, Gabby, thank you for putting us back on the screens. And thank you all for a very short break. Yeah, we heard a lot this morning. So what I'm hoping we can do in the next, oh, sorry, I should, before we go into our debrief, let me just ask if there's anybody online or wanting to speak to the council. This is a time for public input, if anyone would like to talk with us. And Gabby is saying there is nobody asking for time. Okay, thanks, Gabby. So council, what I'm hoping we can do in the next half hour is try to digest what we heard in the previous 3 hours of rapid fire, amazing things happening in this state around early childhood. I hope you all are as kind of inspired as I am in hearing what's happening in a variety of places and programs. And then I think my question for each of you is if you would just take a few minutes, unless you already have your ideas formed, and identify the 1 or 2 priorities that you would have that we include in our letter to the governor. She's asked the council to provide recommendations for her as she develops a children's agenda. And of course, our part is the early childhood part of a children's agenda. As you can imagine, she's not looking for a laundry list of 15 best ideas. So we're going to have to do what we can to kind of filter them down and probably focus them. But it'll be very helpful as staff and I work to write this letter to be reflective of the priorities that you would suggest we should try to put in it, understanding we won't be able to put in everything that we'd like to, but I really need to hear from you as far as what you think should be there. So anyone can start if you all want to take a few more minutes to think about the 3 hours of input we had. It was a lot. And I really appreciated how prepared everyone came, including our agency partners. They obviously had really spent some time thinking about how to form their testimony for the council, their comments. So Subin, what I was just saying was ask, or maybe you heard me. Okay, got it. Yes, so, and as I said earlier, this is not necessarily a legislative agenda for the governor. I want to be clear about that. We'd be wise, in spite of that, we'd be wise not to suggest $100 million investment in something, but it's not necessarily a legislative agenda she's looking for. She's looking for what could a children's agenda, early childhood agenda, what should it look like for the leader of the state?
So I'm totally biased, but I think it should include support for the upstream initiative as a way to accomplish the goal set out for energizing the hubs in Raise Up Oregon 2.0. And I also think it should include support for the home visiting coordination effort.
Yeah.
Now I'll go back to eating. Thanks.
Thank you, Peter. Yes, Ben.
Yeah, I don't have like a direct answer of what could the children's agenda look like, but I have like responses to what we experienced this morning that could maybe an idea will formulate. But this is a moment where it's like both things are true. I'm in extreme support of the ideas and concepts and the Momnibus and the Upstream initiative. And part of me was holding some concern about our existing projects and existing infrastructure and the things that we're currently working on, which we know can always be improved, right? And we're putting attention there. And I worry that we take our gas off that pedal, put it into a new direct, and then we don't actually realize what we've been trying to set out to do with the preschool investments, for example, and what we're trying to do at preschool. So it's like, it's a situation where it's like, I want all the things to happen. And then also, I think within that, what I was kind of hearing in that the narrative that Governor Kitzhaber was giving us, the implicit idea is if this is the best return on investment, we need to take money out of something else and put it in this, right? So we can't have the same pie that we've been working with and just try and shift money within the early learning pie. We need some pieces from other pies to add to the early learning pie, if that metaphor works. I don't know if it does. And so, so that's the other thing that I don't know if that's a popular idea. I don't know. And then I think I'll just stop there. Those were my two big things that, were swirling around within me.
Okay, thank you, Suben. And I think the governor, in reading, a lot of the testimony he submitted, is certainly looking to other funds, whether it's federal funds or other state agency funds that, braiding and blending or whatever words you want to use. So I think he's pretty clear about that. Peter, you may have a better answer than I.
No, I agree that that's absolutely right, that I do think we have to stay within the framework, the parameters that the governor is working in, Delk's also working in, and I think that's where Governor Kitzhaber is for instance, when I talked about our Family Success Plan program, it's currently being funded by existing DHS funds in the family preservation effort area. So I think when Governor Kitzhaber met with Fair Boards, they talked about what are the existing funds that we could simply allocate in a different way to get better outcomes.
Okay, thanks, Peter. And thank you, Suben, for your comments. Marie.
I just briefly, I asked this question of Rep Reynolds, and I'll just bring it up again. I agree with what Suben said. The presentations we heard today were compelling, and there was so much meat in those pieces, but the part that I still feel is missing, and I have said this to you, Sue, and others, is I just didn't even hear much about how we increase childcare. I mean, it is literally one of our biggest limiting factors, and we can't keep doing the same thing expecting a different result. So what is the strategy for us to get there? Unless I missed it, and I know there's a lot of lingo, I'm still learning, but I didn't see that. So I think it's a missing piece, and I'm hoping we can put some energy, effort, and dollars to that. And I think there's existing systems that maybe we can shore up or streamline, or I'm not sure what it is, but if that's not a goal, I mean, the idea that we're gonna, there's not two income families, I mean, that's a privilege, and I think in these times that ship has sailed. Sorry. So childcare, number one for me.
Okay, thanks, Marie. Appreciate that. Katie.
Yeah, I'm going to second what Marie just said, that it's everything is so important. It's so hard to choose what you do, but we still have a childcare shortage and accessibility to childcare shortage. And I would, although I believe in everything that was said with the Momnibus and Governor Kitzhaber, we haven't moved the needle anywhere near enough on childcare. And, you know, if you spread the peanut butter, you have a really, you know, thin sandwich. If you want a better peanut butter sandwich, you got to put more peanut butter somewhere. And I think we need to put more peanut butter in childcare. I really do. The second thing is, I think, and there is an opportunity to learn how well this approach is going with the pilots that were involved, the hubs that were involved. And I'm really interested in the data. How are they tracking success? People served, the thread through pregnancy and into the first year plus and the first 1,000 days. So it would be really great to have data to judge whether or not this is working well or not. And I know there'll be a lot of anecdotal stuff, but data don't lie. And if people are, and I don't know how you pay for that, where you go for it, but if they're utilizing the services, if there's connectivity between all of the things that they're doing as a person is pregnant all the way through the first 1,000 days, where's the thread? Where's the data that we can track that says this correlates to this? And this is how we know. I really love to see that. And I bet it's going to be great. It's just, it's more compelling, and it could really advance some folks to shake some money up somewhere to put into this program and grow it, if we know exactly what the outputs are.
Right. And I'm guessing Peter can help answer that question, but so Peter, if you'll hold that for a few minutes. Ruby, hi, welcome. Thanks for being here.
Hi, thank you. I will defer to Peter if he wants to respond to Katie now. Okay. I agree with Katie, Marie, Subin, on the childcare thing, and you know, the spreading the peanut butter too thin, Subin's analogy. Yes. I know that's not likely going to happen at this point. More money for childcare is not, I guess, not on the table this year or next year. But I think we should highlight that as an ongoing need and concern for this council. What we do have in front of us, I think, is, and I see it both with the home visiting and with the Momnibus and with the OHEC work, is a real opportunity for simplifying methods, processes, strategies for collaboration. So how do we fix policies that prevent folks from working together? How do we streamline things? How do we address things like sharing funding or blending and braiding? I think you said that, Sue, earlier. Those kinds of things. I think that's really impactful at the systems level. And since we're not going to get more money for programs, where can we work right now? And I think it's being creative about how we partner with other organizations that might be doing the same work. We're just not doing it together. We're on parallel tracks. So how do we make it easier for these folks to actually work together? So seeing all the things that were on the council agenda today, and I wasn't here for the presentations, but I'm familiar with all of these projects. I think there's an opportunity there. I don't know what that looks like. Is it agency rules? Is it something else? I'm not sure, but these are all new things that everybody is kind of working pieces of. How do we get them all together? I mean, the different strands of presentations that we heard today.
All right, thanks, Ruby. Great points and great question. Robin.
Thank you. And I think I might be building on what others have just said. But first, I want to address the unfortunate competition in early childhood for funding for families, we shouldn't even be thinking about how there's not enough for childcare and there's not enough for prenatal care and it's just speaks to underfunded work in early childhood. And so I'm hoping that the conversation, that's the one thing we can do, is elevate the need to not put early childhood in a place of having to make decisions about priorities, but that families have the care that they need so that they can work, so they can contribute to thriving communities, and that parents don't have to worry about where they're going to sleep tonight if they're pregnant, especially. So I just was reflecting on that. I think I heard a lot of bright spots this morning of connectivity across the state agencies naming the same or similar priorities, and yet I still am not completely sure where the gap is in actual practice at the state level. Are there still opportunities to partner? I know at the community level, we heard examples of working together across funding strategies and some demonstrations of that. How hard is it for them in the community with the barriers that they may be working with in terms of how state agencies are working together? So there's some fog in front of it for me. It's not super clear where the gaps are, but I saw bright spots and I see opportunities to do systems work that would ensure that communities have an easier time putting into practice blending and braiding and those examples, because it would be my guess that they we say we value communities to lead the way in their community, and yet we sometimes make it hard for them to do that. So where are the areas that the system can make it easier for communities to sort of not have to create new pathways of databases and system alignment, but make it easy for them to make it look the way it needs to in their community? I still feel like there's room for the state level and community level to support each other better. And because everyone has something brilliant to say, I'm going to be quiet, but there's so much to reflect on from this morning. I appreciate all the presentations, and I'll continue to be thinking about how I can contribute.
Awesome. Thank you, Robin. Totally agree about removing barriers wherever we can. Liz. Liz. There is something going on with your audio.
Yeah, it's your sound,
Like
Liz.
your 3-year-old is talking to us. Oh.
Liz, for some reason, whenever we unmute you, it's like a constant echo. I had to mute you just to kind of prevent that, but there's definitely something with the sound on your end. Yeah. Oh, it's still.
How about if I go to Peter, Liz, and let you try to figure out your audio? Is that okay? Okay, thanks.
Thanks.
Peter.
No, I was going to quickly respond to the childcare and the data. I absolutely agree that we do have to have childcare, and the challenge is we don't have the funds to significantly expand ERDC, but we can support the Momnibus effort to expand ERDC, wherever level that's going to happen. We can also support the hubs. And again, I do think the upstream initiative gives potential to help support the hubs increase childcare through funds that they can raise locally, regionally. We could also ask the governor to express support for the federal proposal to cap childcare costs at 7% of a family's income, and have the federal government subsidize programs so we can cap costs at 7% of the family's income. And then on the data issue, we have, I think, a tremendous opportunity with ODHS is that in that they want to help develop the systems to track data and particularly in terms of long-term outcomes. So, as part of our request to the governor is to have in her budget in the narrative saying that she is directing ODHS to work with early learning hubs to develop baselines data on metrics for child and family well-being. They have the capacity to do this work. In fact, I was just contacted by them this week to say, how can we add our data team to the work that you're doing? So they want to be able to track this.
Awesome. Thanks, Peter. Peg.
What everybody else has said, and looking at the data thing, I agree 100%. We want to be sure that we're moving in the right direction. Although there have been multiple studies showing that that model works, it's such a long-term kind of agenda that it's difficult to get data in the short term. But we know that even just financial supports, if we're talking about decreasing the stress on families, just giving financial supports monthly to a study, and I forget where it was out of, showed improvements in child development compared to the control study that didn't receive those or received a much smaller financial support. I do think I agree with, and I think it was Subin that said, we have a lot of things started, and that's not to discount. I think we still need to keep sort of hammering away at the importance of childcare, but I would hate to lose some of the momentum that we have and the interaction. I'm thinking specifically about home visiting and how that interacts in a positive way. If we had a system where we could coordinate that, and it maybe looks different in each part of the state. If we had that sort of system in place, that's going to strengthen all of those things. And lastly, I think that while we clearly have a problem now with social emotional control in young children, I really do think if we can focus on many of the issues in both Momnibus and the success, I think, particularly with the early relational health, I think that we will see marked improvement in that, and probably in the next 5 years.
Wow. Great. That's a timeline that we'll all live to see. Unlike some of these others.
Well, if we can roll it out, I guess everything takes a long time.
Right. Subin.
I'm gonna be my own devil's advocate here and say and recognize that the political window of opportunity where people are putting attention on prenatal to 2 is really unique and a gift, right? For us to say, hey, let's put some attention in this area that we know if we were putting dollars based on how the brain develops, the bulk of our money would go to prenatal to 2. We know that, right? And so I just want to recognize that. Now, my brain always goes to implementation and challenges in implementation. One of the things that is going to blow up, if we get everything that we ask for, is now we're talking about multiple workforces times X, right? Like many more workforces. And so already in DELC, we're having trouble defining workforce because we're not using the NAEYC definition of workforce. We have infant, early childhood mental health consultants. We have coaches. We have providers, right? We have directors. We have all these different people that we're trying to include in the workforce that we're trying to support. So we need to be much more articulate and clear and very action-oriented and individualizing based on these different categories. And then I think the other challenge of these workforces that we're talking about is the mechanisms to support them is not just going to be in DELC, right? We're talking about other departments where, as a council, we've had much less say as to what goes on in those places. And so I heard that conversation starting with Peg and Rev Reynolds around, oh, let's look at what training looks like for doulas and things like that. And it's like, it's a world that I think as a council, I don't know if we have as much control, you know? Yeah.
Yep. Thanks, Suben. You're a devil's advocate. You did very well. Ruby. And then Liz will come back and see if you've fixed your audio, I hope.
Well, I should have put my hand down because Subin just kind of said what I was going to say. I would be remiss to not mention workforce and the challenges that we see currently with workforce, whatever workforce we're talking about in early childhood, and what is the solution for that, whether it, and you know, I know the things we saw today, a lot of it are at the systems level, but on the ground level, it's individuals executing, implementing. And so there feels like there's a disconnect there. If we're making all these plans for these things to happen on the ground, but we don't have the people to make them happen on the ground. So that was my last comment. Thanks.
Yeah, thanks, Ruby. I wanted to ask some of the directors as they were talking about, do you really have the staff to do that? Or is the workforce out there so that you can do what you're wanting to do? Liz, can you? Oh, now we can't hear you at all.
So she did make comments in the chat there about
No, it's weird.
Sorry, Liz, it's still the same. Not sure if you saw my note in the chat, but I think it's like a known Zoom issue, so you might have to like fully reboot your Zoom or your computer. And I'm hoping that that solves it, but I know that that's gonna take some time.
Okay, so we'll read your chat. Disappointed that childcare access wasn't included in the Momnibus bill. I know from my own experiences with early motherhood that access to childcare is central to maternal mental health. Yes, in fact, I think it was Peter sent me a study that showed that, that is directly related. One of the ideas I thought was interesting from Blue Mountain was the idea of redirecting unfilled preschool promise slots into baby promise slots. And that is certainly something that we can talk about. It's an idea I've heard raised in a number of different meetings. So thank you, Liz, for that input. Barry, oh good, your hand's up. I was just going to put you on the spot anyway. So Barry, you beat me to it.
I apologize for not joining this conversation at its beginning. And so if I repeat anything or say anything that's already been said or is redundant, forgive me for that.
No, redundancy is fine. It's just emphasis. No problem.
A couple of things. I certainly I understood, but I was troubled by Representative Reynolds' failure to include some focus on childcare in her Momnibus. Some of you may know that the organization I used to run, over the course of the last 5 years, we produced 2 national reports that showed that core to the economic vitality of our nation is access to affordable childcare for infants and toddlers, to the tune of $122 billion nationally. Yep. And we just did a report in Washington State, 0 to 5. It's 5 point something billion dollars in Washington. It's certainly on the order of billions in the state of Oregon. Okay, so that means as an economic drag, that the lack of high quality affordable childcare for parents of very young children is just a real thing. So if you care about the growth of the economy, you care about the strength of the workforce, you care about any of those things, that's key. I understand the politics of it, right? Because the politics of it are hard. And it's about money. But this is where I like where Peter's idea goes, right? So have the governor point the North Star on this. I mean, I think we should make this recommendation, right? And then point to other partners, including federal, to help us afford to do what we know we need to do. And all of us around the table need to be sort of patient in acknowledging that we're not going to solve this problem quickly, because it's been a problem for literally decades. But we at least should be talking about it in the right way. Talking about it in the way that this is something we need to solve. It needs to be a comprehensive approach. I love Susan's point. It involves a whole host of different workforces and systems that need to be coordinated. That's what Monbus gets right, I think. So it's like, yes, so we need to be talking about how we bring this all together. And Peter, what I loved about what you guys are doing in Southern Oregon is that with structures that don't really work very well, you'll be able to cobble together something that is actually making a deep impact on families with young children. And I can only imagine how much time and effort that took to bring the coalition of coalitions together around that. All I can say is that, again, I think a recommendation to the governor should be, let's make that easier in the short term, right? If we can't invest new state money into some of these issues, let's make at least the coordination at the local level where there's energy and interest and support, let's make that easier. And the final point I'll make is I actually think if that is your focus as the governor, you actually can marshal philanthropic resources to help make. If you have that as your focus in the short term, you could actually make some progress as you try to get all your other governmental partners to invest the resources necessary to help make the larger issue solved. So those are my preliminary thoughts.
Sue, you're muted.
I'm done.
Sorry. Okay, thank you, Barry. Peter.
So this is just riffing, but what if we had talks with the governor about setting goals, or even having her include the North Star, which I appreciate Barry using that phrase, that the North Star, the goal for the state of Oregon is to reach a point where childcare costs are capped at 7% of their family's income, working with the federal government and other partners, and asking each hub to set a goal for the next 2 years of X number of increasing the number of child care slots in their region by X number, to be determined by what the hubs would be. So for smaller counties, it would be a smaller number, but for more populated counties, maybe the hub sets a goal and says we're going to increase by X number of slots, using the resources that we can gather together to bring together to make that happen. It's just a riff thought there, because we're charged with how are we supposed to we're supposed to develop the early childhood system for the state, and I don't think we can afford to take 2 years off from that in regard to childcare.
I would just maybe say if there's a way in which, I don't know that our solution is pouring more money into the existing system and structure, because I'm just not clear that that's going to get to the outcome we intend. Similar to what we heard from Peter, he has literally changed the system in Southern Oregon to be a collaborative wheel that spins in the direction of what's best for young kids and families. So how do we make it so the wheel isn't so complicated? How are the systems in the state going to be malleable enough, or have some tweaks to allow for the goal that we're shooting for? I'm just not certain that if we say we want more childcare, we're going to get there with the same system we have currently. And when I say system, I don't have the specifics, but I know there are a lot smarter people out there that know what are the pieces in the system that need to change in order to make it better.
Yeah, thanks, Marie. Really excellent observation. And, you know, I think, Peter, we might be able to lean on you a little bit in the future and as we're looking ahead to the retreat next month. In talking about, you know, how can the council support system change? You know, I think it's very encouraging that we had the agency directors on our meeting today, right? The key ones, the major players in family well-being. So I think that's very encouraging because it's going to take all of their systems, which is what you, Peter, have done in Southern Oregon. Katie, and then Subin, and then Subin, we need to move on to Seth. Katie.
So we can talk more about this. Obviously, we'll have more time at our retreat, but simply funding the employment-related daycare. So it is servicing all the folks that are waiting. I mean, that's just low-hanging fruit, period. Period. Goes across the state. People can access it. We'll get going. Providers rely on that and the reliability of that system, that program. And I think that would go a long way. But secondly, as we look at how we implement things statewide, I don't know. Does anybody feel like we're the horse and we're pushing the cart from behind rather than pulling it? It's great to have all the agency heads, and I'm so appreciative of it. What's really, really important though is what is the end user? What's the AirPod experience of individuals out there, of all this great work that's been done by all these separate agencies? And is there anything that we can do, going back to that term of upstream, to make it more smooth between agencies so that we don't have to rely on the hub so much to translate? Or maybe it's a combined effort. I don't know, just random thought for your own perusal.
Okay, thanks, Katie. Okay, thanks, Subin, for what you put in the chat. Yeah, all right. Thank you, Council, for your thoughtful input, and we will do our very best in translating this and putting it into a letter. Obviously, childcare will be a part of it. So I guess that's a given. Beyond that, we're going to have to do some creative writing, but we'll get there. And the governor's lucky. She appointed really great people to this council because she had the expectation that we all would have great input for her and help with her direction. So Subin, we now have 5 minutes instead of 15 minutes to listen to your update on the suspension expulsion prevention program. I want to first thank you very much for all of the attachments and the background information that's in our packet and links to all sorts of other documents. So Council, if you want to do a deep dive into SEP, it's in our packets. And Subin, if you could just give us a really brief overview, that would be awesome. Thank you.
I'm happy to take credit for things I didn't do. This update was created when I told folks from Orimha and Delk about this update for the council meeting. They kicked into high gear, and Coalition from Communities of Color, Orimha, Delk, all contributed to creating this update for you. It's not just about the advisory committee, it's about the entire program, which I hope you're happy to see a lot of progress has been made over the summer. So as far as I'll start with the advisory committee. The advisory committee met 3 times since the last time I've given you an update. And so they've been working, and you can see kind of the bullet points of what that work has been in the last 3 months. But of note, There are 3 new members, including 2 CCR&R directors and an early learning hub director, who is also a regional service provider. So we have better representation of people who are kind of on the ground implementing some of the work on the advisory committee. There are early childhood suspension and expulsion prevention program work groups. And so the ECSEP work groups include the advisory committee charter. This is an ad hoc work group to just make sure we finalize our charter, outreach, communication and feedback, data and evaluation, training and technical assistance. And so there are opportunities for people to give their unique perspective and unique expertise in these various work groups, and that happens outside of the advisory committee meetings. And so there is an acknowledgement, of course, that we're asking people to give more to the ECSEP, and so what I do see, however, is that ORIMHA and DELC are doing a great job of staffing and facilitating and making sure that it's as little work as possible for all the basically volunteers who are giving their time to the design of the program. We have also an update from the Coalition of Communities of Color. As you may or may not recall, they are responsible for the evaluation, and they are conducting a kind of a foundational study on where the needs are, what the opportunities are, what the challenges are in the program implementation. They already have an outline of themes, but this is very preliminary themes that you're seeing here in the board documents or in our council documents. There will be more detail, perhaps even some little nuanced differences when we get a bigger report from the Coalition of Communities of Color. As far as ORIMHA goes, there is a lot of action and activity happening with regional service providers. They are getting regular communications. They've had training isn't the appropriate word. They are co-creating together and they are making decisions about what needs to happen in their various regions. Meanwhile, they're getting a real deep dive into infant early childhood mental health consultation. What should a system look like? How are people supported? And getting some really kind of nuanced support about how they can start getting to work in their area. So there's a very detailed methodology to how they're doing it, all based in implementation science, which I was I was geeking out on. And if you want that deeper dive, I'd be happy to meet with you. And actually, what would be better is getting our folks from ORIMHA and their subcontractors who, oh gosh, it's so bad that I don't remember their name. They have a subcontractor, they're awesome, they're researchers, and they are supporting this work. So I would say those are the high level 20,000 foot points that are being made, lots of progress, actions happening.
Sue, you're muted.
Thanks, Subin, very much. Appreciate the high level. Alyssa, will you just mention the meeting that's happening in Salem tomorrow around ECSEP?
Sure. We're meeting with some community partners to talk about, to kind of do a 3-hour deep dive into what's going on with the advisory group, with regional service providers, as well as the mental health consultation development and how it all fits together. We also will be putting out a poll to rename the program so we can stop calling it SEP and ECSEP and string together these really long words and have something that's a little bit more responsive and approachable to community. And so not meant to be a one and done conversation, really to be an opportunity, to Subin's point earlier this meeting, at communicating more of the work that's going on to a broader audience and create space for reflection and discussion and make sure we have those co-creation spaces to make sure we're on the right track to move the work forward with community intention.
Awesome. Thanks, Alyssa. And council members, it's a hybrid meeting. So if any of you want to either attend in Salem or just jump on a Zoom call, whatever it is. Why don't you just let Gabby know, and I'm sure she can give you a link to the meeting. 2 to 5 tomorrow. I assume that's fine, Alyssa. The more the merrier.
It is, except we can't, there's quorum. So I would say let me know, because I know Gabby's hitting the road
Oh,
at the
that's
end of
right.
today. So reach out to me. We have invited a couple council members who've really been engaged in this work so far, but if others are interested, please let me know.
Got it. And Subin wants cookies, so we'll hope that's part of the incentive to attend. Okay, thanks, Alyssa. Forgot about the forum. Okay, let's go to Administrative Rulemaking Council. This is where we actually take action that has an impact somewhere. So Chris, are you leading us off, or Alicia, or how do you want to start this?
I can start it off. Good afternoon, council members. My name is Chris O'Grady. I'm the Legal Affairs Manager here at the Department of Early Learning and Care. And today for rulemaking, you're going to be hearing 3 briefings on rule sets. So this means we're just giving you information on rulemaking actions and you don't have to take action on them. So we'll be hearing briefings on the Certified Family and Registered Family full revision, listening session and work group engagement. You'll also be hearing a briefing on the outdoor childcare update on work that has occurred since June of 2024, and then a briefing on the employment-related daycare changes. We will then end with an action that we are asking the Early Learning Council to make on the employment-related daycare, one of the rules for a waitlist bypass exemption for the Baby Promise program. So I will turn it over to the lovely folks at the Child Care Licensing Division and Alicia to start us off.
Awesome. Thanks, Chris. Welcome, Alicia. Good to see you again.
Thanks. Hi to see you all. Thank you, Chair Miller. I'm Alicia Gardner. I am the Director of Child Care Licensing Division. Thank you so much for having us today. You can actually move forward to the next slide. We have 2 updates for you at CCLD, as Chris said, one related to family childcare and then one related to what we're calling outdoor nature-based licensure. So we can go ahead to move to the next slide. Thank you so much. Wanted to remind the council that this is a final step in a very long-term project, which connects to equity initiatives and CCLD, also connected to Raise Up Oregon, as well as the DELC strategic plan. The council voted on school age rules in 2022, center-based rules in 2023, and this is the final phase of the rule revision project, which involves family child care, both certified family and registered family rule sets. The completion of this project is going to create the foundations for the next steps in our equity initiative work at CCLD to ensure providers have the support, education, and clarity they need from CCLD to be successful with the rules. And we also will partner with them to remove barriers to operation while maintaining health and safety. We know licensing has a role to play in the response to the childcare crisis in this state, and we've worked very closely with program operators to hear those barriers, come up with alternate ideas that will still create safe environments and potentially play a small part to relieve stress on providers as operators, business owners and operators, ensure clarity in our expectations for health and safety, and hopefully just make the system flow a little bit easier. At the same time, proud to say that some of the rules will provide for a no cost, but elevate the quality and kind of what the foundation of licensed childcare looks like in this state. And so a recent paper was released by the Children's Equity Project at Arizona State University. I'm really excited to say that when I read through that paper, CCLD is either meeting these recommendations or we have aligned future improvements within those recommendations. And if you are all interested, I would encourage you to Google that paper and take a look at equity in childcare licensing. Clear rules is a starting point for us. We're happy to present this info for you today for family childcare. And again, we truly appreciate the council's thoughts, recommendations, and guidance as we work towards concluding this very large project. And with that, I'm going to pass it over to Abby Strom, who's going to get a little bit more detailed information for you about what we've been doing with this rule set.
Awesome. Welcome, Abby. Good to see you again.
Hi. Hello and good afternoon, Chair Miller and fellow council members. My name is Abby Strom, and I am an operations and policy analyst with the Child Care Licensing Division. I'm here to present you with a brief update on engagement for family child care rule revision, as well as give an overview of the content and some identified equity and fiscal impacts. Next slide, please. As you can see, we continue to move forward on the rulemaking and engagement timeline for family child care. We are actually scheduled to hold our first RAC meeting for family child care this evening, and those RAC meetings will conclude in the next couple of weeks. And then we will be back here at the council meeting in December with an analysis of feedback that we've received, and then a finalized rule language for proposed adoption. As a reminder, the proposed effective date of these rules for family child care will be July 1 of 2025, which will allow time for us to translate the rules, develop technical assistance forms and other supports for child care providers, train our licensing field staff, and make any necessary IT updates. Next slide. I just wanted to give a really brief summary of the community work group that we held over the summer. We held 3 meetings, and which were held in June and July. 15 participants were involved and included both childcare providers as well as other community partners. We had representation from across the state, and the meetings were offered simultaneous interpretation in Spanish for those needing that assistance. The discussion topics that are listed on the right were our areas of focus. And as a reminder, these discussion topics came from our previous engagement with childcare providers through listening sessions and the online feedback forum, which happened at the beginning of 2024. Next slide. Once the work groups had concluded, we were able to make adjustments to some of the proposed rule language, amend and remove rules based on other feedback. We also, and you will see several of those changes that we made in the upcoming slides. In addition, we collected feedback on any additional resources that may be needed for implementation of the proposed rule changes, whether that might be a fiscal cost, or whether training or technical assistance materials might be needed, such as policy templates. There is an increase in the number of policies programs will be creating, but we are trying to be responsive to that need and provide templates for those required policies. Next slide. So now we're going to dive into some of the content of the rules. But before we begin, we would like to acknowledge that with this revision, as Alicia has mentioned, the rules that apply to family or registered family childcare have been strengthened significantly. There are several reasons for that. Current rules that are in effect right now are vague and broadly written, which has caused some confusion, misinterpretation, and inconsistencies in licensing practice. And CCLD has many internal policy documents that guide licensing staff on interpreting these rules. And really the best practice is to bring that guidance forward and make it visible to providers. Adding specific language and context to rule sets provides families, childcare providers, and our childcare licensing staff with a clear set of expectations. And then finally, minimum health and safety standards should be required in all childcare settings, which aligns with one of the guiding principles of DELC's rule revision project. Okay, next slide. So I wanted to start with some of the equity considerations that have now been included in rule. For those of you that have been here with the adoption of school age rules as well as certified centers, you can see that several of these topics are consistent across all of our license types. I want to also point out that I have included the rule number, the section number next to each content area so that you may, at your own pace, and when you have time, go back and review that specific rule content And again, we are happy to meet or answer any questions you have about specific rule text. Two things that I really want to highlight under the equity considerations are specifically after consultation with tribal representation in the development of certified center rules, we have carried over the use of cradle boards and other Indigenous sleep equipment into the family childcare rules. And also we've added rules around how providers need to be mindful and consider the culture of the children, families, and caregivers associated with the program when planning activities. So really incorporating those aspects of children's lives and families into their daily practice. Okay, next slide. Would it also speak to the fiscal impacts? Overall, there are very minimal fiscal impacts with some costs to compliance. These costs are generally associated with an increase in safety measures. We do want to draw your attention to the one positive fiscal impact, which is we have removed a requirement for a second toilet in certified family childcare. And this potentially could increase capacity in certified family. So if someone only had one toilet, they would be capped at 15 children. But now we have removed that requirement for the second toilet, which potentially could increase their capacity as well as income. The numbers there for the in green are based on the tuition rates from the ERDC market rate study from 2022. There are several kind of smaller fiscal impacts. One is related to safe sleep equipment. This will probably have a very, and by safe sleep equipment, I mean safe sleep surfaces for infants in particular. The federal requirements for infant sleep equipment were updated in 2011, and CCLD did a lot of outreach at that time to ensure that childcare providers had infant sleep surfaces that met those requirements. So we are not projecting that will have the impact of that will be very limited in case they have to purchase a new safe sleep equipment. In addition, we have added requirements for private well testing. So if providers receive or get their water from a private well, this is not new for certified family, but we do have made specific requirements for what testing must be completed. This is new for registered family, so it will be a fiscal impact, and that will be ongoing as testing will be required with each time they renew their license. There are some miscellaneous safety equipment and materials that will need to be purchased. We've made an increase in the first aid supplies that are required, as well as blind cord holders, and it's very small, insignificant, but it is a fiscal identification for field trips like t-shirts or wristbands, and then also helmets for children who are riding wheeled equipment. Next slide. Okay, so the next, and I know I've got to speed up. So capacity and ratios for certified family. In the next several slides, anything with a gold star indicates something that has changed based on community feedback. We've just made a couple changes to not actually what the ratios are, but we did condense our ratio tables, which there used to be 3, and so now there's only 1. We've removed requirements for groups of children being separated in certified family childcare. So because typically they're all together, siblings, they learn from each other in various age ranges. So we've removed that requirement that they have to be separated. And then just recapping what was a fiscal impact as well, we did remove the requirement for a second toilet, which may increase capacity. Next slide. Oh, I did want to also mention that we specifically on ratios that at this time we're unable to make changes to our registered family ratios or the number of children that can be in care because those are established in statute. However, DELC has put forward a legislative concept for the 2025 session to give authority to the Early Learning Council to adopt rules regarding the number and age of children in a registered family childcare, which would align with our other types of care in which rulemaking establishes the staff to child ratios. So that is something to look forward to in the future. Okay. So in terms of assistance, so these are the folks that support the provider in certified family. We've made several changes to support the workforce. We've lowered the minimum age to 14, which aligns with certified center. And then assistance over the age of 18, so that means they've passed our comprehensive background check, can be left alone or work with children alone for brief periods of time. Now we have, if an individual has previous experience as a certified family home, that can transfer to a new home, which has allowed staff to move from place to place. We heard from providers that they often share staff with other programs in their neighborhoods. So now they could just, these staff could move from program to program and fill in where needed without having to work at that specific home. And then we've also added an allowance for individuals that are working within the Child Care Substitutes of Oregon to work at a certified family without experience in that specific home. This really opens up who can access the CCSO. And this is also in response specifically to what we heard from rural providers who have a difficult time accessing the subpool because of an hours requirement. Next slide. Two areas, this is both for registered family and certified family, where we've really strengthened our rules around parent communication. So there are certain specific incidences that must be reported to parents immediately and others by the end of the day. And then there are also notifications that providers will need to get to CCLD, just again to increase that communication piece. Another change that we wanted to highlight was we are actually modifying our exit requirements to match the description that is in current building code. And this is specific to doors, window size, and an access or egress. Existing providers can continue to operate under how we define a usable exit now. Providers with licensure after these rules are in effect would have to meet the new exit requirements. And the impact of this is that it may affect what rooms within the home they could use or what floors they could provide childcare on, such as a second floor or in a basement. And these are really grounded in safety and evacuating the home in an emergency. Next slide. So in terms of record keeping and policies, not providers' favorite things to do. So we've tried to lessen that. And we've also, similar to other rule sets, we've removed common exception requests or waivers, and we've just put those into rules so there's less paperwork for providers to have to complete. We are also allowing programs to store all of their files electronically, really, bringing us into the 21st century and how folks actually store their records. So I'm gonna move to the next slide. Storage of hazards. So this is just protecting hazards from children or protecting hazardous materials from children. This is definitely an area of inconsistency in licensing practice and often something we hear from providers that's quite frustrating. So we have expanded what we inaccessible inaccessible to children to provide a variety of mechanisms that a provider can use to store hazards or make them inaccessible to children. This really will provide some consistency for licensing staff as well as providers, as it's setting a clear expectation, but also providing them with options that really will fit in their home environment. There are specific items, though, medications, firearms, and other items that are considered to be at a higher risk that will continue to have specific storage requirements. Next slide. Outdoor play equipment. We are proposing that specific requirements for outdoor play equipment be included in rule for specifically for certified family. Currently, the rules just reference the Consumer Product Safety Commission's guidelines for home playground equipment, but there are no specifics within that rule, which has led to, again, some inconsistencies in licensing practice. We are proposing to pull the requirements from CPSC and put them into rule, which provides consistent guidance for both childcare providers as well as our licensing staff on how the requirement can be met. Currently, in registered family, there are no requirements for outdoor play equipment. So in an effort to provide some minimal safety standards while children are using elevated equipment in registered family, we are recommending that the elevated equipment over 18 inches not be placed over any hard surface such as concrete or wood or asphalt. This provides a level of protection for children, but to ask registered family providers to meet the CPSC guidelines for outdoor play equipment would be a massive fiscal undertaking for those providers. And one other area specific to outdoor play equipment is now trampolines must be made inaccessible to childcare children. There are a lot of risks and a lot of research in injuries specific to children in using this type of equipment. So we have prohibited that for childcare children, but many families have these in their homes. So we didn't want to ask them to remove them so that their children could continue to use them, but they need to be inaccessible to childcare children. Next slide. And I think that's it. So we have we're working through the RAC meetings, and then both rule sets are currently open for public comment until the end of October. There are public hearings also scheduled for the end of October. And then we will continue to review and incorporate feedback wherever possible. And then we will be back at the December meeting with a brief report on public comment and our response to that. And we'll present the finalized rule language for adoption. Sorry, I went really fast. I tried.
Wow. That's good. You had a lot to cover. Council members, in light of time, if you have questions about anything that was presented, I would encourage you to, you may want to go through Gabby, but to ask your questions offline. Thank you. And Abby, thank you very much. I don't know how you keep track of all of those thousands of pages, but you do a really nice job, and thanks for condensing it for us.
You're welcome. And I think I'm going to pass it off to Carol.
Actually, I think it's Alicia.
Thanks, Abby. Okay, so next up, we have a brief chat and presentation for you all related to the work for CCLD related to outdoor nature-based preschools. This work creates a pathway that was a result of House Bill 2717, which passed in 2023, which requires DELC to create a pathway for licensing programs that are completely outdoors. Note that these programs are currently recorded, meaning they operate for 4 hours or less per day. But this bill will ensure that they can operate for a full day. Providing a pathway for licensure for these programs that are entirely outdoors not only encourages growth for an innovative pedagogy that benefits children's physical health, mental well-being, and cognitive development, it also fosters a connection to nature and environmental stewardship, and it creates a pathway for working families, particularly those who have ERDC funding, to get their children outside and in nature. So we've been working closely with advocates who got this bill passed, and it's been really exciting because we have been able to see firsthand just how dedicated the practitioners of these programs are and how truly unique the childcare landscape can be in Oregon's different climates and landscapes. And so We're very excited to be the second state in the country who will likely be the ones who are licensing outdoor only programs. Washington, our neighbors to the north, was the first state. There are several more states soon to follow. But so the pathway for these programs for licensure will create safe environments through these rules, but most importantly, it's going to connect these programs and the families within them to state resources with just a phone call to DELC or CCLD. So I'm going to pass to Carol to give a brief update on this work.
Great. Awesome. Thanks. Welcome, Carol. Good to see you
Well,
again.
nice seeing you too. Next slide, please. So good afternoon, Chair Miller and members of the council. My name is Carol Peterson, and I'm a policy analyst with the Child Care Licensing Division, and I'm here to give a progress update on the development of the Outdoor Nature-Based, or ONB, rule set. As Alicia mentioned, in the 2023 legislative session, House Bill 2717 passed and requires DELC to create a pathway for licensing childcare programs that primarily serve children in outdoor settings. This is going to be a new license type within CCLD and will result in Oregon being one of only a couple of states that will have outdoor nature-based, or ONB, licensing rules in place. The slide you are viewing shows the progress to date. Over the next couple of slides, I'll provide more details on the guiding principles we were following, as well as the engagement activities we incorporated into creating these rules. Next slide, please. As CCLD develops these rules, we've included guiding principles specific to ONB programs to help us create licensing requirements that ensure children's health and safety in outdoor settings. To do this, we've incorporated as many elements of CCLD's general rulemaking principles that Abby touched on. We incorporated those as many as possible while adding rules that address unique aspects of ONB programs. We're accomplishing much of this work by using Washington State's ONB rules as a framework for drafting Oregon's rule set. As Alicia mentioned, as of right now, Washington is the only state with outdoor nature-based rules in place. In addition to referencing Washington's rule set, though, we have met on several occasions with the Washington ONB rule team, and we continue to consult with them frequently. In addition, we continue to seek guidance from Natural Start Alliance, which is a national advocacy group that has been key with providing ONB research and best practice. And we also have been in consultation with Oregon advocates as well, such as the Outdoor Early Learning Alliance of Oregon, whenever questions come up. Next slide, please. So this slide outlines the specific engagement activities that we've completed, as well as some future opportunities. In April and May, CCLD held a series of 4 community work group meetings to review and gather feedback on topics that pertain to outdoor learning environments. The selected participants represented ONB advocates, ONB preschools who are currently recorded and may become licensed, parents of children who attend outdoor learning programs, and partner agencies. The main topics that were discussed dealt with determining program capacity, staff-to-child ratios, staff qualifications and training, emergency preparedness, as well as risky play activities, since risky play is a key component to outdoor learning environments. The rulemaking team took the feedback that was received during the sessions, and we've incorporated it into the rules whenever possible. Recently, the majority of the CCLD rulemaking team attended an ONB conference in Portland, which was sponsored by the Natural Start Alliance. This provided an opportunity for CCLD staff to engage with other states, as well as participate in site visits to several outdoor nature-based programs in the Portland area. And we continue to engage with ONB professionals in Oregon, and we will be conducting additional site visits to programs who've extended an invitation to us. This is going to be an opportunity to not only view their sites and how licensing rules may impact their day-to-day operation, but it will allow CCLD to further engage with these programs in person. In addition to advocacy groups and OMB practitioners, CCLD continues to engage with other state agencies that may be involved with these programs as they work towards licensing. Examples include Oregon Health Authority, Environmental Health, Fire Marshal, Land Use, State Parks, as well as other DELC programs such as Preschool Promise, ERDC, and Spark. One additional aspect of the rule development process that I'd like to highlight is CCLD's unique approach in structuring the OMB rulemaking team. This team includes licensing specialists who will license the OMB programs, staff who develop technical assistance and program materials, as well as staff from the policy unit. So this cross-agency approach with this structure will assist with expediting the implementation process, since the staff involved with both licensing and document development have been brought in from the start with the creation of these rules. Next slide, please. So now next steps. CCLD will continue drafting OMB rules and engaging with state and national advocacy groups. The RAC will take place in January of 2025. CCLD will present rule content to the ELC in January. Public comment period will be open January to mid-February. Public hearing will take place in February. The final rules will be presented for adoption in March of 2025 with a proposed effective date of July 1st, 2025. So I want to thank you for your time. We'll be back in January to present the rule content, then again in March for proposed adoption of these rules. And if there are any questions, please let Gabby know and we'll be happy to answer those.
Thank you, Carol. We appreciate that. And Council, I asked Carol this question earlier, and she told me that the people who are running these outdoor programs are actually asking for and excited to have this rulemaking process underway. So it's nice to know that we've got that positive input and expectation. So thank you. All right, let's go on to Dorothy. Hi, Dorothy. Nice to see you.
Hello. Thanks for having me, Chair Miller, members of the council. Dorothy Spence, I am the Child Care Assistance Program Manager, and you can go ahead to the next slide. So as Chris mentioned in the overview of the rules, ERDC is presenting on 3 topics today, just for your information. We'll be back for a vote on the verification requirements, caretaker language, and fringe benefits. And then I will be joined by Mady to talk about the final rule change related to our ERDC waitlist exemption. So go ahead to the next slide. The first rule, the rule change that we're presenting today relates to verification requirements. This rule change is to bring all of our verification requirements across our rule set under a single rule that is easier to read and follow. Additionally, there was some language that was inadvertently left out when we moved the rule set from the Department of Human Services to DELC, and want to make sure that those rules get added back in across into this new verification rule. Everything already aligns with our current service delivery and system functionality. So the changes here are really about streamlining and making sure that all verification requirements exist in a single rule that is easier to read and find. So you'll see under the rule changes, we've noted 4 different areas in the rules that are changing. The one that's highlighted in yellow is the rule that's going to be our future verification requirements where everything lives. Go ahead to the next one. Oh, back one. There we go. So the next area that we're changing rules in is related to caretaker language. This is really clarifying language where individual is across the rule set. We're changing, taking out individual and adding in whatever the more specific title is that rule relates to. That could be caretaker or applicant or child, but adding that specificity in the rule. This is to stay in alignment with the language that is used in other self-sufficiency programming rules that also align with the one system functionality. We're also adding in some clarification related to who can report a change for someone's ERDC benefits. It has to be a member of the filing group that is receiving that benefit. Again, this is already current policy. We do not anticipate any impact on service delivery or fiscal impacts, but this change is related to staying in alignment with our other self-sufficiency programs that exist within the one system. Go to the next slide. Our third rule change that we're bringing forward is related to fringe benefits. Currently, ERDC excludes some kinds of in-kind income for the purposes of income calculations for eligibility determination. Both in practice and the system, fringe benefits are a type of earned in-kind income that if a caretaker cannot take it in cash, the one system excludes it from countable income. So this rule language, our rule language has not included fringe benefits as an example of in-kind income that is excluded, even though we already have it in practice as in the system. So this rule change will just allow our rule language to be in alignment with how the system already functions and our current practice that says that fringe benefit, if you cannot take it in cash, is excluded from being counted towards your income eligibility. Okay, go ahead, forward. So these three rules we're just here presenting today for you all. Again, we'll be back in January to present for any action. We did have a rule advisory council last week on this on these set of rules. There was no significant feedback at that time related to these three rules. We have our public hearing in October 16th, and that comment period will end at the end of October. We'll be back in December for an action from you all. And if passed, these rules would come into effect January 1st of 2025. And then I think the next one, I'm going to go ahead and pass to Mady unless Chris needs to provide any context around the temporary rule piece of this.
Nope, we're going to have the presentation, and then after the presentation, we will ask the Early Learning Council to make a motion to vote.
Okay, Dorothy, thank you for your presentation.
Thank you so much. What a lineup to follow. My name is Mady Rosengarten, and good afternoon, Chair Miller and Early Learning Council. I'm managing the Baby Promise program here at DELC, and I'm going to talk for a little bit about this proposed rule change to ERDC and the Baby Promise program. And Gabby, you can go to the next slide, please. So just as some reminders about Baby Promise and the enrollment cliff, ERDC eligibility is required for families to be enrolled in Baby Promise, and this is done through the one system. There is a rule that already exists that allows some populations to bypass the ERDC waitlist so that priority populations can continue to access ERDC when a waitlist is in place, like we have right now. Baby Promise is not currently an exempt population from the waitlist. And what we have learned is that this fall, about 1/2 of the children currently enrolled in Baby Promise slots across all 3 regions of the program will age out, creating many empty slots. And with a waitlist active to access ERDC, families must meet a bypass exemption or be already approved, but not yet connected to a provider. You can go ahead to the next slide. So we've got some 2 remedies in process here. And the first one that we started some months ago was to reach out to the group of families who are in the eligible but unconnected to a provider bucket, I call it, in the one system, and look for those who are interested for Baby Promise and have a baby or a toddler. This project is just finishing up with the 3 Baby Promise regions. They're working to contact these families and support their needs. And just a little context as this work has been going on. There were approximately 550 families on the list of eligible but unconnected folks in that group, and 450 of those were in Multnomah County. The work has helped us to enroll a few, less than 10 families, and we've been identifying reasons why families are unconnected, which is something we're very interested in knowing more about. Working through this project has also helped us to place some families on regional baby promise wait lists. And you can go ahead to the next slide. So I wanted to share with you some of the reasons that families are telling us why they are approved, maybe approved for ERDC, but unconnected to a provider, because we know that was a large group. And you can see there are many reasons we've collected thus far, although not that many were collected from multiple families. There are about 3 at the bottom of the list that many families reported. The others were all individual. So there are many, many reasons, which is an interesting thing to look at and something that we are going to continue to talk about. And I wanted to note that DELC is working on a survey around this topic that's going to go out this fall. So this is something that we're working on at DELC. And you can go to the next slide. So here's the second remedying process and why we're here, and that is to process a rule change that will allow baby promise as an exemption to the ERDC waitlist. Historically, there's been a long-standing practice of having a bypass for contracted slots that are connected to ERDC. But when baby promise enrollment was linked to ERDC enrollment, this bypass exemption was not added into rule. And now I believe Dorothy is going to talk a little bit about what's happening next.
Thanks, Mady. You can go ahead to the next slide. So this is just like our similar slides. It just goes over the actual rule language. We are adding baby promise to contracted slots as a priority population that's exempt from the ERDC waitlist. As Mady mentioned, baby promise and ERDC are inextricably linked because ERDC is a requirement of baby promise, and would just add that little bit of rule. The one thing I might want to add to what Mady has already shared around the numbers and the for the program, that the 72 slots that we have available, we really did try to find other avenues to fill those slots. But unfortunately, the other avenues that we have tried have still led us to a place with a significant number of open baby promise slots. And without the bypass to the wait list, we run the risk of not being able to sustain this program. Go ahead to the next slide. If this rule does go into effect and we do have a baby promise exemption from the ERDC waitlist, just wanted to provide a brief overview of what that process would look like. A baby promise enrollment partner would identify a family for a slot. They would complete an exemption, a waitlist exemption form and give that to the family, who then uses that to apply for ERDC. That is essentially saying, hey, I can skip the ERDC waitlist because I am being put into a baby promise spot. The family then applies for ERDC, will go through the eligibility determination process and then loop back around to their baby promise folks to complete that part of the process. And I think if you go to the next slide, it is an overview of the next steps. As you'll see, it is very similar to our previous timeline for the rule changes. We did have a rule advisory council, and comments on our wait list and the impact of the ERDC wait list did come up through the course of the RAC as well. The rules being presented today for a temporary rule change, it would become effective on October 16th, which is when we would have the system change able to do the bypass. There is a public hearing on this rule that is open on the 16th. The public comment period ends at the end of October, and we would come back in December to move this to a permanent rule change, and if passed for permanent rule, become permanently effective January 1st.
Chair Miller, did you want to take any questions or comments, or did you want to ask the Early Learning Council to vote on the temporary rule change?
Yeah, thanks, Chris. Are there questions of Mady about Baby Promise and this proposed rule change? Mady, I would have one question on Baby Promise not related to the rule change. And I don't know if you will have this depth of knowledge, but the number in Multnomah County was staggering. And do you know, are they connected with Preschool for All? Are they working at all in tandem with that program?
If you're asking if Baby Promise is working in tandem, I would say no, the enrollment processes are separate.
Okay. Okay. Yeah. Okay, any other questions of Mady? If not, I'll ask Katie if she would put a motion on the floor, please.
Sure. I move to adopt the proposed temporary rule language amendments dated September 25th, 2024 for a temporary Oregon administrative rule change to 414-175-0010.
All right, is there a second for that?
I'll second.
Thank you. Discussion. Questions, comments?
My only comment is making sure this is easily understandable for folks to navigate who are trying to get into the ERDC. Yeah.
Good point, Katie, thanks. Okay, those in favor of the motion, please raise your hand or say aye, whatever works for you.
Aye.
Gabby, I think you can see everybody's in accordance. Anyone against? And any abstentions? Nope, it's unanimous. And we do have some comments or questions. Marie and then Sue Ben.
No comment. I think
Sorry.
my hand was up.
Sorry. Marie, did you have a comment?
No, inadvertent hand raise.
Oh, it's probably to vote. Okay, and Sue Ben sing with you, is that right? Okay, sorry. Too many symbols here and there. Okay, passes unanimously. Thank you very much. We'll hope that bypassing the wait list fills the slots. So will you report back to the council at our, I guess it'd probably be our December meeting when you have enough time to know if it has made a difference or not?
Absolutely.
Okay, thank you. Thanks, Mady, for all your work to try to make that program effective. Okay, Chris, thank you for pulling all of the rule making together for us. We know it's an important function of this council.
Yeah, thank you so much for your time, council members.
Yeah. All right, council. So in the 7 minutes we have left, I wanted to just talk a little bit about the retreat that's coming up in October. Gabby, I know it's still a draft, but will you put the draft up on the screen? And mostly, I want to thank Peter and his sidekick Renee for putting together a really robust retreat for us, and it's starting on Monday, the 28th. So this is similar to what Katie did for us in Bend and the Central Oregon last year. So hopefully everyone can get to Grants Pass by 3 o'clock on Monday, the 28th. And you'll see, Gabby will send this out to everybody. It's not final, and so she was holding off until we had all of the blanks filled in. But at this point, I just want to make sure you've got it on your calendars, so you know it's not just starting Tuesday morning. So we'll start in Grants Pass in Peter's front yard, I guess, and we'll see some programs there, then go to Medford. The Children's Museum is very kindly opening on a Monday when they're normally closed. So we appreciate their willingness to do that. And we'll have a community reception. Peter has said that if any of you have people down in the, Medford, Grants Pass, Ashland area whom you would like to invite to the reception, just send their names to Gabby. And she can get invitations out. We just need a count by a week before, I think. So Grants Pass, then we go to Medford by 5, and then we drive to Ashland, and the rest is in Ashland. So I just want to make sure that we're on everyone's calendar. Peter, in light of everything we've heard today, do you want to make any other comments about us coming to your territory?
No, just looking forward to it, and we'll do our best to make sure everyone has a great time.
I'm sure we will, even though the festival will be closed by then.
Right.
But we will still have a great time. All right. Thank you, everybody, for your time, for your input. Yes, we've heard a lot. We will do our best to put an appropriate letter together for the governor. And then staff and I will continue to work, and we'll be coordinating with Peter as we put the real structure together for the retreat. Our real work, we'll hear from community partners Tuesday morning, and then our real work session starts at noon on Tuesday, goes all the way till 5, and then we'll have a reception, and then we work from 8 to 1 on Wednesday. So come well rested, I guess, is probably the message. And if you have specific requests or interests in what we cover at the retreat or how we structure it, etc., please just send me an email because that's what staff and I'll be working on in the next few weeks. So we'd love your input. All right, any other final comments from anyone? All right, thanks everyone. And Gabby, thank you for holding it all together as usual. Take care. Have a great rest of your day.